Good morning and welcome, everyone. My name is Judith Taveria, and I am the lead designated federal officer for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, which I will refer to as the Commission. It is my pleasure to welcome you to the 8th public meeting of the Commission, which was authorized through President Biden's signing of Executive Order 14031 and amended through Executive Order 14109. To advance equity, justice, and opportunity for Asian Americans, Native Hawaiians, and Pacific Islanders. Since our last meeting in October 2023, the Commission's 6 subcommittees have continued to engage with subject matter experts, deliberating and preparing recommendations that will be shared in detail, both with the full Commission and the public over the course of this meeting. This is a federal advisory committee, and it operates under the regulations of the Federal Advisory Committee Act. The advisory committee process ensures independent review in an open and public forum with public opportunities for public participation. To ensure that all voices are heard, we need the public's cooperation in organizing communications with the Commission. For our community members and partners watching the live stream of this meeting, the broadcast includes an American Sign Language interpreter and closed captioning services for those who are hard of hearing. We will not be having oral comments at today's meeting. However, you may submit written comments at any time to AANHPI Commission at hhs.gov. That is AANHPI Commission at hhs.gov. Your messages will be shared with the Commission for their consideration. Tomorrow, commissioners will host an in-person listening session to hear from individuals who responded to the Commission's request for public comment posted in the Federal Register earlier this year. If any members of the Commission are contacted by special interest groups, please refer the contact to your designated federal officer. We will arrange to share the information with the full Commission in accordance with FACA requirements. I also invite members of the public who are tuning in to visit our website at hhs.gov/about/WIOMP for updates on the White House Initiative and the Commission to learn more about our activities. That is hhs.gov/about/WIOMP. There you can find information about the Commission, including their charter, commissioner biographies, and past meeting materials. We will also announce upcoming Commission meeting dates and locations on the site, as well as through the Federal Register. I am pleased now to introduce Ms. Crystal Ka'ai, who serves as the Executive Director of the White House Initiative and the Commission. She is the first Native Hawaiian to be appointed to this role, where she is responsible for advising the Biden-Harris administration on the coordination and implementation of federal programs, policies, and initiatives to advance equity, justice, and opportunity for Asian Americans, Native Hawaiians, and Pacific Islanders. Please welcome Ms. Crystal Ka'ai.
Thank you so much, Judith, and aloha, everyone. Good morning or good afternoon, depending on where you are joining us from. Also, we wanted to wish a happy Lunar New Year to all who celebrate, as well as a happy Mahina Olelo Hawaii or Hawaiian Language Month. As the Executive Director of the White House Initiative and the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, it is my honor to welcome you to the 8th public meeting of the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. And we are doing this meeting here in Clark County, Nevada. Since the commissioners were first sworn in 2 years ago by Vice President Kamala Harris, they have convened regularly as a full commission and also at the subcommittee level to create recommendations to advise President Biden on ways to advance equity, justice, and opportunity for our diverse Asian American, Native Hawaiian, and Pacific Islander communities all across the country. Our commission is housed within the U.S. Department of Health and Human Services, and we are co-chaired by 2 members of President Biden's cabinet, and that is HHS Secretary Javier Becerra, who you'll be hearing from shortly, as well as U.S. Trade Representative Ambassador Catherine Tai. And under their leadership of our co-chairs, as well as all of the esteemed commissioners who are represented here today, we have seen tremendous progress made for our AA and HPI communities in such a short amount of time. To date, the commissioners have crafted and approved 70 recommendations to submit to President Biden and implemented many of these recommendations in real time. And this includes a number of recommendations that the administration has worked to ensure are really implemented and executed for our communities. This includes hosting a series of regional economic summits, which was a recommendation from the commission, hosting the Biden-Harris administration's inaugural AA and NHPI Mental Health Summit to address the mental health crisis in our country, and so much more. And again, so much of this work is due to the hard work of each and every one of our commissioners represented here today, both in person as well as those who are joining us virtually. They have put in so much work, so much time, so much energy over the past 2 years to ensure that our diverse communities have a voice at the highest levels of government, advising the president, advising the vice president, and the entire administration on ways to better engage and connect with diverse communities across the country, and also helping to shape the policy of this administration to make sure that it is more inclusive and responsive to our diverse communities. We are again here in Nevada, as Judith mentioned, because the commission has also made it a priority to ensure that we are meeting communities where they are. And that means getting outside of the DC bubble and going out directly into communities to be able to host engagements, listening sessions, to be able to connect our communities with federal resources across the federal government. And so tomorrow we will be in Clark County, Nevada, hosting a public listening session with community leaders, both in the state, but also those who will be driving in from and flying in from around the region. And again, these listening sessions, these engagements are so critical to informing the commission's work. As part of this effort, the commissioners have posed questions to the general public on ways that they can better utilize their commission and their subcommittee time to advance equity on a number of issues, from economic equity to health equity to immigration and citizenship to language access and data disaggregation, and so much more. And this just is a really small example of the breadth and depth of the work that this commission has focused on over the course of the past 2 years. And another really key priority as we are here in Nevada is the need to ensure that we are doing more to continue to uplift our communities, promote inclusion and belonging in all aspects of American life, and also to continue to combat anti-Asian hate and xenophobia and sentiment that we know unfortunately still remains a very top concern for so many in our communities. So their safety and security of the Asian American, Native Hawaiian, Pacific Islander community is something that this commission has actively worked to tackle over the course of its tenure, and something that again has been so deeply needed and felt in community as we continue even years after the pandemic to feel the impacts of that xenophobia and racism. So I really want to thank all of our commissioners for their tremendous work. There's so many hours that go into the work that they do to craft each recommendation, meeting with experts, meeting with government officials, and making sure that they are also listening to the public, listening to stakeholders from diverse backgrounds, ethnic backgrounds, religious backgrounds, and subject matter expertise to really ensure that what they submit to the president truly reflects and responds to the needs of our diverse communities. So as I mentioned, we are going to be joined by two of our co-chairs who will be joining us virtually, and one of whom is our co-chair, Secretary Javier Becerra, the Secretary of Health and Human Services. He is such a strong champion for our community. He serves as the 25th Secretary of the Department of Health and Human Services and is the first Latino in history to ever hold this office. And previously, he served as the Attorney General of the state of California and also served 12 terms in Congress as a member of the U.S. House of Representatives, where he was a strong champion for justice and equity throughout his entire career and represented an area with a very large Asian American, Native Hawaiian, Pacific Islander population in the state of California. So as I mentioned, he has been such a strong champion and fighter for our communities. We are so lucky to have his leadership as the co-chair of our commission, and also the support of the U.S. Department of Health and Human Services to ensure that the commission is resourced with the resources and the staff that it needs to function and to execute on behalf of the American people. So I know that Secretary will actually be joining us live from Washington, DC, although virtually. I am not sure if he is yet on. Okay, we are actually still waiting for the Secretary to join us. So we will pause for a little bit and we will circle back once he is live. Oh, okay. Great. It looks like he's here. Good morning, Mr. Secretary. Good afternoon. We just introduced you. You're now live on mic, and we just wanted to hand the floor over to you for your remarks.
What, I'm sorry, was that Crystal? And Crystal, did you
Yes.
just say you recognize?
Yes.
I just got the audio, so thank you. Well, first, can I just say to Ambassador Tai, to Crystal, to Erica Moritsugu, thank you so much for all the work that I've had a privilege to do with you, and certainly with each and every one of the commission members. Thank you. What, 8 times now we've gathered. Lots of different recommendations that we're making. I think if you take a look at what the president has asked all his different departments to do based on the work of WIOMPI, I think we should feel very proud. I know that we're going to continue to push the envelope. I would say nothing less than that's what you should do. And I must tell you, because I am not able to join you because I am in the state of Alabama, that we got to push. There are too many things happening in this world to Americans and to folks around the world. There are too many things happening for us not to believe in these positions that we have a chance to be in, that we will not push. And so I hope that you will stretch what you believe this commission can accomplish. I hope you will stretch what you believe the president will accept. And I hope you will stretch what the various departments of the US government can achieve based on the recommendations of this commission. I think in the last 3 years, from what I've seen, that each and every one of you, because you put in the real time, have really made a difference. And I am proud that this commission is based at HHS. It has a home. I hope you feel comfortable in that home, but we're going to push. Our team will push. And to Crystal and her team for all the good work that they have done, I just say thank you. I'm in Alabama. I'm still very hopeful that good things can happen in Alabama. I am hopeful that in today's meeting, you all as commissioners will cast some great votes and give me a whole bunch of extra work to do. So thank you for what you do. Thank you for letting me be a part and partner with you in this. And thank you for believing that our federal government and this administration can make a difference in the lives of all Americans, but certainly for Asian Americans, Native Hawaiians, and Pacific Islanders as well. That's our charge. As I always say, never do mild when you've got a chance to make a difference. So thank you for having me. I hope you enjoy the stay there and you will complete your term for this particular meeting in ways that will make me say, why did I ever say to give me more homework? But thank you all very much.
Thank you, Mr. Secretary. Next, we have a special video message from our other co-chair, U.S. Trade Representative, Ambassador Catherine Tai. I'm just going to give her a really quick introduction. Ambassador Tai was sworn in as the 19th United States Trade Representative on March 18, 2021. And as a member of the President's Cabinet, she is the Principal Trade Advisor, Negotiator, and Spokesperson on U.S. trade policy. She's also one of 4 Asian American women in the President's Cabinet, and someone we are very proud to have representing our community. Prior to her unanimous Senate confirmation, Ambassador Tai spent most of her career in public service, focusing on international economic diplomacy, monitoring, and enforcement. She previously served as Chief Trade Counsel and Trade Subcommittee Staff Director for the House Ways and Means Committee in the U.S. Congress. And she also is an experienced World Trade Organization litigator and has just such tremendous experience that she brings to the work that she does in this really prominent role representing the United States, both at home and abroad. And so we are so honored to have her as our co-chair. We will turn next to her special message video.
Hello, everyone. Thank you so much, Crystal, for your introduction and for everything that you do. I also want to thank my co-chair, Secretary Becerra, for his partnership and Erica for her continued leadership. I want to welcome each of you to this 8th public meeting of the President's Advisory Commission. You have done so much work since our first meeting in May of 2022, and your recommendations like hiring permanent staff for the commission and hosting a mental health summit have been so vital to delivering tangible benefits to our AA and NHPI communities. I want to highlight one of those recommendations in particular, the Economic Summit Series. I remember participating in the very first one in Philadelphia. It was such an honor for me to see firsthand how we can team up to bring real change for our businesses and workers. These summits have played an important part in building our economy from the middle out and the bottom up, as President Biden says, to advance equity and economic security, to democratize opportunity for more people. I know that about 250 participants joined the most recent summit in Atlanta. To date, we've hosted 6 economic summits in total and discussing additional ones for later this year. This is vital to make sure that we get outside the DC bubble to meet you where you are, where you live and work. That's the only way your priorities can help shape our work. This is why I'm so glad that you are also having a listening session while you are here in Nevada. Our communities have been through a lot over the last few years. I'm thinking of all those affected by the Monterey Park and Half Moon Bay shootings last year during Lunar New Year celebrations. I'm also thinking of the Maui fires, the people we lost, and the homes and livelihoods that were destroyed. I was just in Lahaina last week to meet with the local leaders and community members there. We also know all too well that bigotry and violence continue to be real daily struggles. But in the midst of all these trials, I also think that we have found a way to grow stronger together, more resilient, more caring, more united. Day in and day out, you are doing your part. You are bringing us closer to fulfilling our nation's promise of liberty, equality, and justice for all. What makes us connected to this land we call home is not some physical connection or relation even to our founding fathers. It is our enduring commitment to make our ideals a reality to all those around us. Your devotion is moving us forward. It may be hard sometimes to gauge progress, especially when tragedies and roadblocks arise without warning. But I want you to know this: your dedication is making a difference. You are addressing hate and discrimination. You are making sure that equity is not just a buzzword, but something that can be felt in people's hands and in their pocketbooks. You are raising immigration issues that affect our communities, and you are tearing down the language access wall, one brick at a time. You are on the front lines. Thank you, thank you, thank you for all you are and all you do. People say that what happens in Vegas stays in Vegas. Well, not in this case. Your work will reverberate far and wide and continue to be the basis to craft practical solutions to real problems. I want to tell you again that from President Biden and Vice President Harris on down, our entire administration is fighting alongside you every step of the way. I am humbled and inspired to have you as partners. Thank you again, and I will now turn it over to my dear friend, Erica Moritsugu, Deputy Assistant to the President and Asian American, Native Hawaiian, and Pacific Islander Senior Liaison.
Aloha, y'all. On behalf of the White House, welcome to our commissioners, both here and online, and our live audience for the 8th meeting of the President's Advisory Commission on AA and NHPN here in Clark County, Nevada, my home away from home. I want to begin by thanking the President's commissioners for their tireless work over the past 24 months. Your service to the community and our president will have a lasting impact, and we're indebted to you for your commitment of time, energy, muscle, wisdom, and tolerance for Zoom calls. President Biden ran for president to restore the soul of America, to confront racism, xenophobia, and hate in all of its forms. And that's what the White House has remained committed to doing, especially since we last convened in October. In November, the White House announced the development of the first ever U.S. national strategy to counter Islamophobia in the United States. For too long, Muslims, Arabs, and Sikhs in America have endured a disproportionate number of hate-filled attacks and other discriminatory acts. Small Business Administrator, Deputy Administrator Dalawar Saeed and I traveled to multiple cities across the nation for community meetings with South Asian, Arab, Muslim, and Sikh leaders. In December, the White House recognized the 80th anniversary of the repeal of the Chinese Exclusion Act, which for 61 years in our history weaponized our immigration system against an entire ethnic group and was a part of the anti-Chinese driving out era. Last week, the administration reaffirmed the federal government's formal apology to Japanese Americans on the Day of Remembrance of Japanese American incarceration during World War II. This year marked the 82nd anniversary of President Franklin D. Roosevelt's Executive Order 9066, which led to the incarceration of over 120,000 Americans of Japanese descent. It's by honoring the legacy of civil rights leaders who bravely defended our people against the injustice of the Chinese Exclusion Act and Executive Order 9066, but also in celebrating the immense contributions and strength of Korean Americans on the 121st anniversary of the date upon which the first group of Korean immigrants landed on our shores on Korean American Day. And by celebrating the rich culture and heritage of Lunar New Year, Tet, and the Tibetan Losar New Year. As a nation, we acknowledge our history, we recognize the progress we've made, and we celebrate the diversity that is this country's strength. Our history reflects the strength of this community. Over the past 6 months, as Ambassador Tai mentioned, we've witnessed the amazing courage and strength of Hawaii. Neighbors helping neighbors, community members coming together to support one another, and the resiliency of the Aloha spirit as Maui recovers and rebuilds. And the Biden-Harris administration continues its promise to do everything in its power to help Maui recover and rebuild the way the people of Maui want, while respecting sacred lands, cultures, traditions, for as long as it takes. The administration has provided more than $330 million in federal grants and disaster loans to support response and recovery efforts, and approved more than $43.7 million in assistance to over 7,000 households. And that's some of what brings us to this work. See the strength and resilience of the Asian American and Native Hawaiian Pacific Islander communities, and the important role that this commission in addressing hate crimes and inequities, including the commission's efforts to ensure that traditionally underserved communities have a voice at the highest levels of federal government. It's moments like these when we need to remember the president's word. Our diversity is our strength, and we are all Americans. The best way to be involved is to help us stay true to our values here at home. Extend a hand to your neighbor, volunteer with your local service organizations or house of worship. Keep from building walls between you and your fellow Americans. It will take all of us to do so. Serve our country, our commissioners, our staff and colleagues, and those of our public in the virtual audience. Mahalo nui loa. Now, I'm incredibly honored to introduce Madam Chief Commissioner Sonal Shah to provide us with today's commission's charge and goals for the meeting. Madam Chief, the floor is yours.
Thank you, Erica. Thank you for the introduction. Thank you for the. More than anything, a huge thank you to you and Crystal for your leadership in the administration and to all of the people who do what we have with us as our community. So thank you. I'm just going to repeat again. First of all, a huge thank you also to our co-chairs. Nothing gets done when you don't have good co-chairs in the administration. And we have two co-chairs in the administration, U.S. Trade Representative Ambassador Tai, as well as HHS Secretary Seta. They are huge champions for us, and a lot of the work gets done internally thanks to their leadership. So we really want to thank them. And can we also just thank everybody on the team for the commission? the amount of work that it takes to pull together subcommittee meetings, get all the recommendations, put it together, to make sure we're all coordinated, to make sure all of our timings are coordinated. And it's not a very large team, so really for the amount of work that they put in and the cheer by which they do it is incredible. So I want to just a huge thank you to all of you. The commission is authorized from Executive Order 14031 as amended by Executive Order 14109. These executive orders establish the 25-member commission, President's Advisory Commission through September 2025, and charges this commission with advising the president on ways to advance equity, justice, and opportunity for AA and NHPI. Key priorities for the commission range from advancing inclusion, belonging, and public awareness of the diversity and accomplishments of AA NHPI access and closing gaps in health. Culture, Pre-Parties Commission in public awareness of the diversity accomplishment of API people, cultures, and histories to improving data disaggregation, language access, closing gaps in health, socioeconomic, employment, and educational outcomes, identifying strategies to increase public and private sector collaboration, and much more. I know you won't do this every single day, and it's a lot, and there's a lot happening. In fall 2023, President Biden signed Executive Order 14109 to extend our commission's term for 2 more years through September 2025. The president also expanded the commission's role to include the ability to serve as spokesperson on behalf of the commission to better engage the public on our work. Our commission and subcommittee roles, the commission and each of the subcommittees are tasked with conducting research and to inform their policy recommendations. And to our public, just a reminder that that is a lot of work to pull together and to do all of that research, because as each of these recommendations come through, it's not just a recommendation, it's actually the amount of work that we listen to the community, we listen to experts, we listen to organizations that are working on specified on the issues that we're all working on our subcommittees. All of that comes together to make a recommendation. So these don't come light, they come, there's a lot of recommendations, ideas that get funneled into what becomes recommendations. A reminder to everyone that the commission only makes policy recommendations. We do not make policy. We are proud that many of our recommendations are being implemented by the president. However, our role is to advise the president, to advise the administration, and to our colleagues. We are independent federal advisory committee, not federal government employees. As a result, we do not make policy on behalf of the Biden-Harris administration, nor do we represent the administration's decisions. We want to ensure that the public is aware of this important distinction. As of October 2023, the commission has approved a total of 70 recommendations on a rolling basis. Let's just hold that for a second. 70 recommendations on a rolling basis. That is a lot of recommendations. And the administration, the officials, everybody is working alongside us and helping us craft these recommendations, which is important. Each recommendation represents a step forward in addressing the diverse needs and challenges facing our community. In today's session, you will hear directly from subcommittees as they present on the priority areas and problem areas that they have been focused on. Additionally, they will share their recommendations they have drafted to present to the full commission and to share with the general public, with all of you. There have been several updates to subcommittee membership since our last meeting. 4 commissioners have rolled off the commission. And we have undergone some membership changes to the subcommittees. So on behalf of the commission, I would like to extend my sincere gratitude to the community in Nevada, especially Clark County, for hosting us in the government center. Let's just give a hand to the We are here to recognize and celebrate the vibrant and growing AA NHPI community in Nevada. AA and NHPI community makes up 10.3% of Nevada's population and 12.2% in Clark County, according to the census. So that is a very large AA and HBI. It's important that we're here to hear from the community also. A reminder to the public that there is no in-person participation for the February 27th meeting. The commission is hosting an in-person listening session tomorrow, February 28th, with the local Nevada. Should there be any recommendations that require further refinement or exploration, the commission will decide to revisit these before making final vote and advancing them to the president. To our commissioners and to our colleagues, please remember to turn your table tents up if you have if you would like to speak, and remember that the entire room is mic'd. So whenever you speak, and if you're having side conversations, those side conversations will interfere with the conversation that's being had together. So if you would like to have a side conversation, you are welcome to walk aside and have a side conversation, but please remember that to keep the flow, it's important. When we go into breaks throughout the day, please remember that this meeting is being live streamed, so you will need to stay seated until you are given a cue that the live stream has paused. And with that, I want to say just thank you to all of you for the amount of work that goes into coming to the commission meetings, and it is such a pleasure. I'm going to turn it over to Sarah.
Thank you so much, Sonal, and thank you everybody who is joining us on this live stream, as well as all the commissioners. We are about to go into the presentation of recommendations from each of the 6 subcommittees, and we will start off with the Belonging, Inclusion, Anti-Asian Hate, Anti-Discrimination Subcommittee, and I will hand it over to Emily.
Thank you, Sarah. The Belonging, Inclusion, Anti-Asian Hate, Anti-Discrimination Subcommittee was co-chaired by Louisa Blue and Dr. Kamal Kalsi. Members, including myself, are Daniel Day Kim, Grace Wong, Samita Shah, and since October, 2 other commissioners have joined the subcommittee, Teresita Batiola, Victoria Wynn. Our non-commission member is Madiha Al-Hussein, and our DFO is Judith Toria. We've had 2 presentations. The first one was from Sheila Foran and Robbie Monteleone. They presented on the Department of Justice's United Against Hate program. Sheila is a special legal counsel, Civil Rights Division, U.S. Department of Justice, and Robbie Monteleone is the attorney advisor, Executive Office of the United States Attorneys. Our second presenter was Dr. Sarah DeGood. She presented on current research and programs for preventing community violence. She's a senior health scientist, Center for Disease Control Injury Center, Division of Violence Prevention. Our subcommittee has 11 priority issue areas. Supporting leadership opportunities for AA and NHPI individuals in government, business, nonprofit, and media. Education about AA and NHPI communities. Address educational equity and access to opportunity. Standardizing hate crimes and hate incident definitions. Addressing the needs of AA and NHPI communities in the aftermath of the Lahaina tragedy. Increasing federal transparency on data regarding domestic terrorism and white supremacist organizations. Alternative means of reporting hate crimes or hate incidents. Improving federal data collection of hate crimes and hate incidents. Prevention of anti-Asian hate in all spheres of life, including media, business, education, government, and online forums. Increasing resources for victims. And preventing gun violence targeting AA and NHPI communities. Now I will turn it over to Daniel Day Kim, Commissioner Kim, for the problem statement and recommendations.
Hi, everyone. For our problem statement, I just want to make sure that everything is set on my end here. We see the issue of youth bullying as being an issue to spotlight for this meeting. Youth bullying, victimization, and perpetration is connected to increased risks for negative mental health outcomes and antisocial behaviors, including substance abuse, interpersonal violence, and criminal activity. The 2021 Asian American Bullying Survey indicated that 80% of the Asian American respondents reported that they have experienced bullying in person and online. The same report indicated that approximately 1/3 of adults failed to take action after learning someone was being bullied. A 2019 survey of over 800 California, Asian American, and Pacific Islander youth reported that 1/2 of them had experienced bullying in school. So our recommendation is that the administration should reinvigorate the Federal Partners in Bullying Interagency Task Force to strengthen coordination, federal agency responses, and prioritize the federal infrastructure for anti-bullying activities, including AA-NHPI communities. The White House should reconvene its anti-bullying summits and include WIANPI, federal agencies, social media platforms, community organizations, and educators to share strategies, highlight, model, and promising practices and policies to address bullying and to address corporate accountability. The Department of Justice, or DOJ, Department of Education, DOE, and Department of Health and Human Services, HHS, should increase prioritizations of funding and resources in their grants to support anti-bullying programming, prevention, and intervention, and research efforts, especially to support local communities of practice for educators and community members to address bullying against AA-NHPI young people. In addition, as part of their anti-bullying efforts, HHS and DOJ should collaborate to develop a guide for navigating federal mental health and education resources for AA and NHPI students. The federal website, stopbullying.gov, should be updated to be more accessible to AA-NHPI communities by providing information and resources in, at a minimum, the top 5 most frequently used AA-NHPI languages, and including more content and resources about preventing and addressing cyberbullying and internet safety, as well as information about the impacts of bullying in AA-NHPI communities. DOE, HHS, and DOJ should improve disaggregated data collection about bullying of AA and NHPI youth, and DOE should strengthen mechanisms for students and their families to report their experiences of bullying and responses to bullying. So we'll open it up for discussion from here.
Are there any comments from all commissioners? Grace?
Yeah, so I was gonna say that we have the subcommittee had the benefit of a lot of work that's been done over the years since, the early part of the Obama administration. And there have been many efforts initiated during that administration, and several recommendations have been made. And much of our recommendations developed based on, some of what's been left undone. And so we've had the benefit of a lot of folks that have been working in the arena for a while to share with us where some of the big gaps are. So I just wanted to commend the recommendation to you. Hope that we can continue to work on these efforts, because as Daniel mentioned, hearing from a lot of young people about their continued experiences of bullying, and when they experience it, not getting good responses, culturally and linguistically relevant responses for their families.
Thank you, Grace. Any comments from the commissioners online? Daniel?
I just want to dovetail on what Grace was saying. This recommendation builds on the work of specifically Malik Panchali and his work with the previous commission. He has his recommendation can be found in, I think, in earlier documentation. And he went on to start acttochange.org, which is an anti-bullying organization focused on the needs of AAN and HPI youth. We are looking to build on that foundation, as well as follow up on the work that they did earlier in their administration.
Thank you so much, Daniel.
I just have a quick, thank you. I just have a quick suggestion on wording, so should be updated to in a defeat form. But I don't think it's just the actual wording. It will be updated to be more accessible. Just want to get rid of that. Right. So my form is the first time. And then afterwards, you use A and HPI language, just comma and instead of including it. Sorry, I can't.
We'll include these changes and update them for when we do final votes, all the subcommittee recommendations.
Heidi? Thank you very much for this recommendation, and I know that bullying of any kind is unacceptable. I wonder if the subcommittee discuss whether or distinguish race-based bullying versus just bullying, and is that something that was discussed? Is it something that's unique to Asian Americans experiences? And I understand that the recommendation says that at least the top languages should be have information in those languages. But other than that, is there any sort of additional recommendation or discussion about whether are the kids being bullied because of their race or ethnicity, and distinguish between those?
Grace.
Yeah, so in terms of what the background information that we received, what it covered not only race-based bullying, but the different kinds of bullying that AA and HPI youth experience. And some of it was, because of race, some of it could have been because of gender, some of it could have been because of perceived national origin, range of different things. And so religion, another one, but and religion, actually some of the background data showed where folks, had more than one axis or basis for difference, that those young people experience more bullying. And so, we didn't hone in on that in terms of the recommendation itself, but really wanted to make sure that there's ongoing communication efforts to make sure that the resources are relevant to members of our AA. Ajay?
I think it's an excellent recommendation. Often the youth, many times the youth do not know if they are being bullied, what is bullying, and how to report the bullying. So, this recommendation, what we have, the second part, federal website, bullying, should be updated and access to more and create awareness. It's an excellent one.
Thanks. I like this recommendation. I am wondering if the subcommittee gave any thought to make it dovetail, the summits dovetail a little bit with the Youth Mental Health Summit recommendation that we had made previously at previous commission meetings. And maybe that could be something that is tied together or referenced. I think they should be separate summits, but maybe they can have panel tracks of both. Like the bullying summit, anti-bullying summit have mental health components, and the mental health summit have maybe this is more operational, but anyway, it's very, very, important for the health equity subcommittee as well.
Thank you. Definitely incorporate. Do that, but I just want to make a quick comment that when we were sort of thinking through this recommendation, bullying doesn't just end with school. You know, it spills out into community, and it doesn't just end when kids finish going through school. You know, it's not just happening in elementary schools and high schools and colleges. It's happening in workplaces and other institutions. And so I think as we move forward with this recommendation, you know, I think I challenge all of us to think of bullying in a sort of a larger sphere and how it, you know, it overlaps with discrimination and hate, violence. It's really more on a spectrum of bullying. So, but the subcommittee worked, especially Daniel and Grace worked very, very hard on this. So, thank you.
Thank you so much. Any other comments from online? We're about to take a short break. All commissioners should stay in their seats until the live stream is paused, and once confirmed, commissioners will take their seats. Thank you so much. Thank you so much to the committee for the recommendation. Welcome back, everyone. Before the break, we heard presentation and discussion on the belonging subcommittee's recommendation. We will now move to the data disaggregation and education subcommittee to hear their presentation. And I will turn it over to Commissioner Emily Chen.
Hello, on the data disaggregation education subcommittee, the co-chairs are Dr. Reynolds Samoa and Dr. Robert Underwood. The members are myself and Kai-Ying Yang. Our non-commissioned member is Dr. Joseph Kiabe Kahalukula and Dr. Nunez Ponce. Our DFO is Erica Minori. Our subcommittee has 5 priorities. Ensure equitable data inclusion through data collection, analyzing, and reporting, especially for marginalized AA and NHPI populations, consistent with how AA and NHPI communities define themselves. Facilitate improved access for community advocates to use federal agency data to more effectively inform policy changes. Foster impactful 3-way dialogue between communities, academic researchers, and federal agencies for more consistent reporting. Provide greater understanding of disproportionalities in education for AA and NHPI students in K-12 and higher education. Lastly, ensure attention and equitable treatment for Asian American and Native American Pacific Islander eligible institutions and Alaska Native and Native Hawaiian serving institutions. We had 2 presentations. Mike Boadwin, Assistant Professor of Education and Principal Investigator of the Minority Serving Institutions Data Project at New York University, presented on higher education issues for ANAPESIs and MSIs. Robert Teranishi, Professor of Social Science and Comparative Education, the Morgan and Helen Chu Endowed Chair in Asian American Studies at the University of California, Los Angeles, presented on data disaggregation issues for AA and NHPI students. Now we'll hear from Commissioner Underwood and our recommendations.
Good morning, and if you're in Guam, it's really morning, it's 4 p.m. So, I wanted to give some background to the recommendation that we made. Basically, there is a disparity in the level of funding for higher education opportunities and college completion programmatic efforts through minority serving institution designation. There are many reasons for this disparity related to historical factors and enrollment patterns, but the assistance given to ANAPESIs is clearly inadequate. And we recognize that this process is primarily driven by Congress, but we need to point out that the funding for ANAPESIs is inadequate. While many federal agencies provide additional access to resources and services through MSI initiatives and efforts, many ANAPESIs are not considered or even consulted on a regular basis regarding these programs in various agencies due to beliefs such as model minority myths, erroneously aggregated data, and lack of coordinated efforts. Additionally, there is a need for data disaggregation to explain the totality and diversity of the Asian American, Native Hawaiian, and Pacific Islander community in education. For example, Southeast Asians and Pacific Islanders are 3 to 5 times more likely to not complete college as compared to other Asian American groups. In addition, just an example here close to home in the University of Nevada, Las Vegas, the count for Pacific Islanders is 240, that's the official. But if dual designation was included, this could rise to 1,653 Pacific Islanders, resulting in only 1/6 of the numbers of Pacific Islanders being counted here at UNLV. Recommendation number 1, and I want to point out that ED here refers to the U.S. Department of Education. ED should develop a specific outreach effort and increase financial resources for NPZ program support. This should include technical assistance workshops for NPZ's principal investigators, advocacy with other federal agencies, and additional personnel resources for NPZ efforts within the ED. NPZ institutions must be specifically included in MSI programs in all federal agencies. There are numerous MSI programs to include the National Science Foundation, U.S. Department of Agriculture, U.S. Department of Defense, U.S. Department of Interior, National Endowment of the Humanities, U.S. Department of Commerce, the U.S. Department of Transportation, and the U.S. Department of Health and Human Services, which typically accept programs for Native American, Hispanic, and African American communities. The executive branch must ensure that all these programs include NPZ eligible programs by advocating for a more inclusive and accurate definition of MSI. The third part of this recommendation, the executive branch should jointly coordinate and collaborate with all White House initiatives targeting minoritized communities to develop an action plan to remove dual and multiple designation barriers to accessing of funding. 4, the ED should sponsor another I-Count Summit and related research activities in order to fully understand the disproportionate impact of federal data systems and practices on the ability to track educational experiences and outcomes for different ethnic groups within the AA and NHPI community. This should include an examination of the integrated post-secondary education data system, more commonly known in higher ed as IPEDS process, and how the 2-res designation is used in counting students and how it is more likely to suppress the representation of particular groups such as NHPI students.
Thank you so much. Are there any comments from our commissioners online or here in the room? Usual age.
I'm glad you pointed that out.
Hearing none, I'll move on. And we will next hear from the Health Equity Subcommittee from Teresita Batino. Thank you so much.
Health Equity co-chairs are Carrie Doy, Mia Ives Rubley, and myself, Teresita Montayola. Our members are Dr. Kimberly Chang, Dr. Kamal Khalsi, and we have recently welcomed Dr. Reynolds Samoa along our membership. Non-commissioned members, Dr. Quinn Metzger, and our DFO, Ms. Erica Snignoy. Our priority issue areas are healthcare workforce, environmental justice, combating domestic, intimate, physical, and/or sexual violence, the impacts of artificial intelligence on AA and NHPI populations, human trafficking, aging within AA and NHPI populations, culturally and linguistically appropriate health outreach and education, and AA and NHPI anti-bullying resources. As you can tell, there are some overlaps with the work of other subcommittees. This time around, we had presenters to our subcommittee, which included John Bulbus, Director of the HHS Office of Climate Change and Health Equity. He presented on his office's efforts to address the intersectionality between health equity and climate change and its impacts on the AA and NHPI communities. We also had Ana Mascarenas, Senior Advisor for Environmental Justice and Climate Change, HHS Office of Environmental Justice. She presented on approaches to the intersection of climate change and environmental justice and OEJ's work. And I would like to turn it over to one of our co-chairs, Commissioner Diya Ridley, to talk about the problem statement number 1.
Thank you so much. I have the honor to present this first problem statement and recommendation I'm actually calling in from Hawaii, which is it seems relevant for our recommendation that we are doing today. The problem statement is that Asian Americans, Native Hawaiians, and Pacific Islanders are much more likely to suffer significant negative impacts due to climate change. From land and water contamination to climate disasters, AA and NHPI have dealt with disastrous events that have forced them out of their homes and communities. The federal government must improve targeting of resources to AA and NHPI communities to address climate change, particularly in the Pacific region. Now, I want to give you a little bit of background before I go into the recommendations. I think it's really important to understand that with 2% Celsius of global warming, Pacific Islanders are 10% more likely to be impacted by inland flooding, and Asians are 8% more likely to see increased childhood asthma. Also, Asian Americans are more likely, 32% more likely to live in heat islands, which are urban areas that have higher temperatures than their surrounding areas. Natural and human-made disasters continue to devastate and destroy AA and NHPI communities. We saw this in all parts of the United States, but in particular, we have seen this affect the Pacific Islands. One of the examples would include Red Hill disaster that contaminated communities with toxic fuel and de-icing agents, and the massive fire that destroyed the historic Lahaina community and killed over 100 people. So it's very important that we address specific issues that impact AA and NHPI communities in the Pacific region. Now, our first recommendation includes establishing an interagency task force to include organizations like the U.S. Environmental Protection Agency, or EPA, the Federal Emergency Management Agency, also known as FEMA, the National Park Service, the U.S. Department of Health and Human Services, the U.S. Department of Energy, and other agencies and departments to address environmental climate change concerns for Hawaii and other Pacific Islands. Number 2 is to establish a regional research center in Hawaii to include a water testing laboratory that can deliver reliable test results to Hawaii and other Pacific Islands in a timely manner. One of the things that we found in our research was that there were issues with receiving reliable test results because it was taking so long for samples to get to the mainland to be tested. And so it's very important that we get a research center that can do this laboratory testing on an island in the Pacific. Number 3, which if you can move to the next slide, is establish an additional environmental justice thriving communities technical assistance center or satellite site to Hawaii to cover Hawaii and U.S. territories. This will allow Hawaii and the U.S. territories access to technical assistance in obtaining federal grant funding. And lastly, to provide more transparency to the public on the environmental impacts of the fuel leakage from the Red Hill underground fuel storage facility. The water and environmental impact studies must be made widely available, and communities should be updated on air, water, and soil quality. And now I'd like to open it up for questions or any comments.
Dr. Underwood?
Yes, I heartily endorse this recommendation. Sometimes it's a little bit hard to envision this, but most Pacific Islands, when discussing existential threats, identify climate change as the main existential threat to their existence. So it covers a whole range of issues, mostly environmental, but water quality, the threat to coral reefs, which significant part of the environment, and of course, people who live in low-lying atolls. We're already experiencing population changes that are kind of loosely connected, and sometimes as time goes on, basically climate change refugees. So this is important, and I believe the federal government has a strong responsibility to pay attention to this issue, particularly in terms of Pacific Islands, and especially when it comes to water quality, as in the case in Hawaii and in the case in Guam and other places where human activities are affecting that direction.
Thank you, Dr. Underwood. Any other? Total? I guess I was a little surprised that there isn't a testing facility, an EPA testing facility for water on the island that has to come back to the to get tested. So I think it's an important recommendation, and the idea that the testing takes place closer to where the communities are, where it's trusted actually. So great to know, but alarming, especially in today's time where it shouldn't be possible.
Yeah, there are water environmental research institutes that exist in all states and in the territories as well. But sometimes I think they're referring to higher levels of sophistication. So there are basic water quality tests, but I think the kind of sophistication to identify particularly gas runout that happened in Red Hill.
Thank you so much to the Health Equity Subcommittee.
We have a second recommendation.
Oh, sorry.
Health Equity Subcommittee has a second recommendation to address the healthcare workforce shortage crisis and increase culturally and linguistically appropriate care for AA and NHPI populations. The problem statement. The workforce shortage problem has been urgent for a very long time. Continued provider losses are happening with burnout, worker pay and conditions, and retirements. Populations in need of culturally and linguistically appropriate care face barriers to accessing health care and may delay or stop people from seeking care. Resolving the workforce shortage problem and ensuring culturally and linguistically appropriate care will take determination, creativity, the elimination of systemic deterrents, and long-term investments for many years to come. So a little bit of background and rationale for this recommendation. The crisis with healthcare workforce shortages is multidimensional and multi-tiered. The shortage crisis existed prior to the COVID-19 pandemic, worsened during the pandemic, and continues to persist today. The impacts reverberate across the spectrum of healthcare institutions and all populations in need of healthcare. However, the impact on populations in need of culturally and linguistically appropriate care is potentially worse. Language, cultural, and other barriers exist that may delay or stop people from seeking care. Once care is accessed, they might encounter ineffective and confusing care due to the language, culture, and other divides. The Commission applauds HHS efforts to address a long-term, persistent, and systemic problem.
This includes a July 2023 announcement on a new HHS healthcare workforce initiative that includes a coordinated department-wide effort to identify opportunities to improve healthcare workforce recruitment and retention and career advancement with equity at the center of its work. It will help to elevate workforce programs and activities across the department, engage with stakeholders, and identify opportunities to further advance federal efforts to support the workforce. The recommendations work to ensure that HHS, in collaboration with DOL and ED, or the Education Department, is addressing the gaps in care to deliver linguistically and culturally appropriate health care to AA and NHPI populations at all levels. At the same time, agencies should leverage AA and NHPI populations as a source of healthcare workers, spanning the range from providers and nurses to key functions that include mid-level professionals, community health workers, caregivers, interpreters, and other workers providing direct and supportive services. Now, the recommendation itself. The subcommittee recommends that by June 2024, the U.S. Department of Health and Human Services does the following. 1, HHS convenes in collaboration with the U.S. Department of Labor and the U.S. Department of Education to assign a work group to disaggregate and report healthcare workforce shortage data on AA and NHPI populations across the 3 executive departments. B, form a task force to identify needed policies, funding, and programs to address healthcare workforce shortages, such with an emphasis on AA and NHPI needs through a range of training levels, including on-the-job, high school, apprenticeships, vocational school, community college, university, and post-employment opportunities. And C, align workforce development systems, guidance, outreach, and implementation efforts. Recommendation 2, under this big umbrella recommendation, HHS needs to increase support for community health centers and health center lookalike organizations through the HRSA, Health Resources and Services Administration, Bureau of Health Workforce, and the Health Center Program to implement policies incentivizing more AA and NHPI healthcare professionals to join health centers, including broadening the pipeline for current and future workers to ensure medically underserved populations across the country have access to care. Develop and implement programs targeting underserved populations, particularly those with language and culture competencies, to become part of the healthcare workforce with earn while you learn training and apprenticeship programs, signing bonuses, and other supports such as childcare, transportation, uniforms, etc. B, identifying existing funds to create an emphasis on attracting, developing, hiring, and retaining workforce from underserved communities at all levels, from caregivers to support workers performing front and back clinical functions to the professional levels. Continue to uplift the impact of critical healthcare workforce programs, including the National Health Service Corps, which provides scholarships and loan repayment programs to providers, the Teaching Health Center Graduate Program, which supports primary care medical and dental residency programs, the Nurse Corps Scholarship Program, which supports educational costs in exchange for commitment to serve healthcare shortage areas, Title VII, Health Professions, and Title VIII, Nursing Workforce Development Programs, which provide education, professional development, and financial aid to train the next generation of health professions in primary care, and the Community Health Worker Training Program, which works to increase the number of community health centers. C, continue to increase efforts to address healthcare shortages beyond providers and nurses. D, increase culturally and linguistically competent and appropriate workers who can communicate effectively with AA and NHPI patients
clients, and communities through job-based training opportunities. And then the third recommendation under this umbrella, HRSA Bureau of Health Workforce to work with DOL and ED to increase direct engagement with AA and NHPI communities and providers who serve AA and NHPI communities as it implements its workforce initiatives to share best practices such as methods to decrease the impact of social determinants on the potential pipeline of health workers. Examples, access to affordable training, childcare, transportation, and technology. B, state workforce expansion efforts such as apprenticeship programs and medical and dental assistant apprenticeship programs. C, efforts to establish a crosswalk competency trainers, i.e. skills, knowledge, aptitude, and career ladder programs that build from entry level to advanced level competencies to address clinical, technical, behavioral, cultural, and language gaps. And D, efforts to address the healthcare worker burnout and mental health crisis. As a final word, it may seem as if these recommendations are copious, and part of the thrust of this is making sure that the different federal agencies who are already doing programs and actions regarding a very deep crisis on the healthcare workforce shortage, that these agencies actually work together. So we're now open for questions and comments. Louisa?
Yeah, thank you. I support this recommendation, but we should probably do two subcommittees, the economic equity subcommittee and healthcare committee to talk and collaborate here, because we did have a discussion on the shortage of registered nurses, and we met with people from the federal government in person to talk about what it looked like the landscape. Sorry. And to look at the landscape of the shortage of registered nurses, and in particular, making sure that we have bilingual and bicultural competent professionals in that thing. So we should talk about it, because for the RN shortage, it's not just a shortage here in the United States, but it's an international shortage exacerbated by COVID.
Yeah.
Right, where people. So let's talk about that, because the data that we saw was interesting, but it really needs to get broken down more. Right, and that's where the data disaggregation committee can come in, but it really needs to get broken down. Right, because there's a shortage in terms of registered nurses in Native Hawaiian, Alaskan, in Native American.
Yeah. Absolutely. As I indicated earlier, there are overlaps among the different subcommittees, so that is a very critical thing that we do that. But one thing that was really key to our discussions is that we cannot just focus on the doctors and the nurses. That the shortage impacting our community the most is because we don't have workers across the spectrum.
Right.
Anywhere from caregivers to community health workers. We just don't have enough who have the competencies in language and culture that could really help move the healthcare indicators for our community.
And then I also just want to mention that I know that there are community-based API-NH community health centers that understand that need, and they will set up their own programs.
Yeah.
Right, to try to recruit college students, they intern, they volunteer, just as a way to get them into the pipeline, into the healthcare industry. But the rural areas are really suffering, right? Because everybody wants to live in an urban area. But the AA and HPI community is growing in the rural areas, and it's very hard for them to get to a house, let alone a hospital. So, and it's copious. Your recommendation is copious, but it's important that we go public on what the needs are and scratch that surface. And then maybe the next, commission can scratch it even deeper
Right, but there is a need for coordination at the federal level.
Thank you, Lisa. Victoria?
Yeah, Victoria Nguyen, thank you to the Health Equity Subcommittee for this recommendation. I know it is a long one, but a very thorough one. And it's more of a comment of we saw many delays of care in our community, people falling through the cracks. Because they could not access places with people that looked like them, that spoke their languages. And we saw that heightened during the pandemic, and even after the pandemic, the recovery of that, we're still in the middle of that. And I just wanted to, again, uplift many of the regions, right? We're not all created equally, and the disparities across the region of, how people are accessing care and service from people that look like them. And people having to resort to like short-term things like telemedicine, for example. And even then, that's not always available in certain areas, in certain languages, certain communities. But I also wanted to uplift, other agencies, right, that could come into play, like the Office of Refugee Resettlement that does career pathway programs. And how does that coordination happen to ensure that, these pipelines also include newly arrived Americans, right? Our new Americans in our communities, like refugee communities, who may come with professional licenses in their own countries, but maybe with, the transfer doesn't exist, right? Here in America. So just wanted to point that out. And it's such a beautiful recommendation. I know it is long, but it's much needed in many of our communities. So thank you for that.
Thank you. Kimberly? Kimberly Chang. So I think I'm on the Health Equity Subcommittee, and I just wanted to point out that this is a very important and critical time, because when the president released his budget last year, in it, there was specified innovation fund for the Bureau of Health Workforce. And so we really want to ensure that the Health Resources Services Administration and the Bureau of Health Workforce, in conjunction with the Department of Labor, take a look at this recommendation and prioritize the language needs of our communities, language and cultural needs of our communities, and training up when they start developing, once the budget gets passed, this innovation program.
Kelsey?
Thank you. Kelsey, also a member of this wonderful subcommittee. I just wanted to highlight how hard members of this subcommittee were. Just want to say kudos on that. But when we talk about the workforce, sometimes we focus heavily on getting more nurses in, more doctors in, or the pipeline side of things. But sometimes we forget about the other side, which is the burnout and all the issues that cause workers to leave the workforce, which we've seen during the pandemic. So I really love that we address that. Thank you.
Thank you so much. Thank you for these important recommendations to the Health Equity Subcommittee. We'll move on now to the Economic Equity Subcommittee. And I will turn it over to Commissioner Kevin.
Thank you, Kevin Kim. The Economic Equity Subcommittee has 6 current members. The co-chairs are Ajay Victoria, Simon Tang, and Smita Shah. The members are Louisa Blue, Carrie Doi, and myself. And I want to take a moment to acknowledge the 3 members of our subcommittee who are no longer on our committee, but contributed so much over the past few years. Michelle Kalhane, Ai-Jen Fu, and Kimberly Chang. Together, we had a very busy 24 months. We had over 12 recommendations put in. But for this committee, as it is for this entire commission, it's not really about the quantity of the recommendations. It's always been about the quality. And so I just wanted to highlight 2 quick recommendations that have really had an impact in the community already. The Economic Summit that has been mentioned a couple of times, which I think therefore makes our team the 18 today. I mentioned it, right? So the Economic Summit, that has been since January 2023, doing a national tour and already hit 6 major cities. And I know the one in New York City, for example, that I attended, I'm still hearing from small business owners and ANHPI workers about how much they learned from that particular event. And we're really excited that this tour is going to be an ongoing tour. So looking forward, please look out for it to come to your city. We also wanted to just talk about this other recommendation that's being implemented actually on March 7th. I was given permission to mention it. It's regarding the recommendation we made previously, increasing AA and NHPI applicants in the federal workforce. I just want to commend Riampi for putting together an event for March 7th, where they'll be co-hosting it with the Office of Personnel Management and the Department of Transportation. And they're expecting a couple of hundred attendees to come and learn more about the opportunities within the agencies, outside the agencies, have senior leadership come and speak to this group. So I think that this recommendation being implemented will also have a big impact on our community. So thank you for that. The 4 priority issue areas that we have, and for this particular meeting, we don't have a specific recommendation, but we've had a lot of robust discussions about future recommendations. And the priority issue areas that we are covering here are opportunities for small businesses, access to job training and workforce development, opportunities for AA and NHPI workers, and compliance and regulations. And so I will just touch briefly upon the opportunities for small businesses and access to job training and workforce development, and then Commissioner Pang will talk about the other 2 priority areas. When we look at these priority areas, we really do look at economic equity from all perspectives. It's not just about the small business owners. It's not just about the workers. It's about the community banks. It's about the nonprofit lenders in our community. So accordingly, on the opportunities for small businesses, we've talked about increasing opportunities for all businesses, including export opportunities. We've talked about the community banks and small banks to participate in more federal programs. And then a real big issue about just access and awareness. And the language committee, it's so important because the language access committee is really helping us get to where these businesses need to be and where the workers need to know about their rights and the information that will help them be protected. And then in terms of job training and workforce development, we want to make sure that workers have access to childcare, paid leave, and long-term care across all industries. And that the jobs of the future in particular, with AI coming, we want to make sure that the AA and HPI youth have access and the skills to be able to participate in that. With that, I'll turn it over to Commissioner Pang, and then following that, we'll turn it over to Commissioner Bloom and Commissioner Vittoria to talk a little bit about the presentations we've had during this past 3 months.
Thank you, Commissioner Kim. We spent a lot of time in this discussing, I think, 24 hours at least, twice in a week, about this. It's a very important issue, Simon says. So opportunities for AA and HPI workers, we need to addressing the income inequality and wage gap for AA and NHPI women. Ensure the rights of workers are respected and right to organize. With regards to compliance and regulations, review compliance and regulation related to workforce development and apprenticeship programs. Regulations regarding small business, job opportunities, and workforce development should be inclusive of AA and HPI issues. Thanks. Oh, Lisa.
Hi, Louisa Blue. So our subcommittee had a lot of discussion about the shortage within the registered nurse workforce that's been exacerbated by the COVID-19 pandemic. And I experienced it firsthand because I was on the Alameda County Health System commission there, and we couldn't find enough registered nurses to fill the gap. So we have nurses working 2 shifts, right? Rarely with weekend because they were covering for other nurses who were sick with COVID. So it was a robust discussion, and we had some people come and talk about the shortage. The names. So we heard from Hayden Kempley, who's the Deputy Director of the National Center for Healthcare Workforce Analysis. And then also Elizabeth Pittry, who's the Senior Advisor from the Office of the Associate Administrator for the Bureau of Health Workforce and the U.S. Department of Health and Human Services. And then we have Dr. Ryan Ho, who's the Director of the hospital and ambulatory group, and the Director of the Division of Practical Services. So they do collect data. The latest data they have is for 2022, but that data has not come out yet when it comes to the RN thing. But I just wanted to share what the data look like in terms of the breakdown of registered nurses in this country. So it's still a predominantly white workforce, 2.3 million, 72% of the workforce. There's an increase in Hispanic nurses, 346,000, which is now 11% of the workforce. Black American nurses, 257,000, 8%. Asian, 174,000, 5%. Native Hawaiian, 21,000, only 1% of the workforce. Native American and Alaskan, 21.5 thousand, and then other is 87,000. And it's mixed race and those who decline. So there is the shortage that's happening. It's not only a national impact of this, but also international. We're going to have to compete with other countries who are also recruiting registered nurses from other parts of the country. And then there's also educational issues, right? Because you have to have a master's degree to be able to teach RN programs, and we don't have enough of those master degree registered nurses who can teach at that level. So it's a discussion that we have to dig into a little bit deeper. And then also just touch bases more with other federal agencies that probably keep track of this, but we just need to hear from them. But it was kind of very eye-opening. And so we decided at the end, like, okay, well, we can't really deal with some of the educational shortcomings that are out there because there aren't enough RN programs anymore. And the move from 2-year programs is now moving into 4-year programs. And so you're talking about economics also, whether or not our folks can actually afford to go to a 4-year program. But there are scholarships that are available from HRSA to help address that. It's getting the word out to our communities on what's available. It's a lot of discussion. And mental health is a big issue because we have to have cultural and bilingual staff to be able to carry that. And we don't have it. So anyway, that's all I have to say as a former registered nurse. I have to deal with the shortage when I first started as an RN back in the mid-70s. Right, and here we are again dealing.
Thank you, Commissioner Blue. In continuing our presentations, we had a presentation by Dr. Ryan Ho, Director of Hospital and Military Policy Group, and Gifty, Director of Division of Practitioner Services, Center for Medicare and Medicaid, U.S. Department of Health and Human Services. They discussed and presented on reimbursement process for home health care givers. It's important, I mean, Dr. Ryan started the presentation by providing a contextual background of themselves and their work. They primarily handle the payment rates and rules under Medicare and Medicaid. Recently, they shared that recently they finalized payments under Part B. According to Dr. Ryan, Part B payments recognize that community care individuals play an ongoing role in sustaining the overall well-being of patients. Part B also applies to a set of services that involve medical professionals training behavioral health to caregivers. This policy change was spearheaded by community and stakeholders' opinions. And because of the community advocacy, the Center for Medicare and Medicaid will be able to propose and finalize separate payments. From a broader perspective, these caregiver training services are a piece of the healthcare puzzle, but they recognize that caregivers are an integral part of this treatment process. Gift be added during the presentation by noting the work is not yet done. Caregivers need more support and recognition for their work. And but the establishment of payments in 2004 is a step in the right direction.
And I just want to close the presentation by, again, encouraging the viewers and hopefully tomorrow too, to have people in the public really send us recommendations. And that would be, I think, something that would be great to have for this particular next session. And then last but not least, I have to just thank Judith Peria, who's our DFO. And not only does she have to be with me for this entire commission, but she has to deal with us as a subcommittee. So thank you for all of that. More thank you.
Thank you so much to the Economic Equity Subcommittee. One quick reminder is everyone in the room can silence their phones for notifications. We are also, just for those of you who are joining us on the live stream, we would like to change the schedule and just go right into the remaining two subcommittee recommendations, which include the Immigration and Citizenship Status Subcommittee, as well as the Language Access Subcommittee presentation. That will adjust our schedule so that we will miss this break. And we will then break for lunch with the commissioners and reconvene at 1:30. So with that, I will turn it over to Kai Ying, who will present.
Thank you. Nyajong and Sabaidi to all online for joining us today. My name is Kai Young. I am the proud co-chair of the Immigration and Citizenship Status Committee, along with my friend Grace Huang, Commissioner Huang. The members are Ajay Bhutoria and Dr. Robert Underwood. And thank you, Simon, for serving with us for a while, and I know you rotated off. Our ex officio member is Carol Wu, and our DFO is the amazing Judith Tara Yu. Our priority issues have been very grand, but this is a very important issue. This subcommittee is very important to all of us. And so I just want to go over the 10 priority issues that we've been working on. One is the universal legal representation for individuals facing removal. Two, improving language access for individuals at risk of or facing immigration proceedings, including detained individuals. The third is reducing immigration-based visa backlogs. Fourth is employment authorization for individuals in long visa backlogs. Fifth is community-based alternatives to immigration detention center, immigration detention. Six is reducing the immigration court backlog. Seven is protection for undocumented API individuals. Eight, strengthening asylum processes. And the ninth one is examining the impact of controlled application review and resolution program, otherwise known as CARP, on immigration status. And the 10th priority issue is securing access to benefits and resources. In this quarter, we had only one speaker, that is Elizabeth Mura, Senior Advisor at the United States Citizenship and Immigration Services of the Department of Homeland Security. She presented on the affirmative asylum process and challenges exacerbating backlogs in processing affirmative asylum applications. We have two recommendations this round, and I would like to hand it over to my colleagues, Commissioner Grace Huang, to present the first one, and then after her will be Commissioner Robert Underwood.
Thank you. So the first recommendation that we're bringing forward today is one that we've been looking at for a while, but United States Citizens and Immigration Services, USCIS, which is under the Department of Homeland Security, continues to subject individuals from primarily Arab, Middle Eastern, Muslim, and South Asian communities to increased national security vetting under the Controlled Application Review and Resolution Program. In 2008, USCIS had issued policy guidance creating a national security vetting program that outlined how to identify and address national security concerns in certain immigration-related applications that include naturalization, adjustment of status, asylum. So according to data collected by organizations that have filed litigation to challenge the program, CART disproportionately affects Muslims and those perceived to be Muslim, particularly from Arab, Middle Eastern, and South Asian communities. And because of CART, individuals waiting for their immigration cases to be resolved remain in limbo for years. Those impacted by CART allege their immigration cases are being held without due process, including being properly notified about the bases for the case and not being provided an opportunity to respond and are being denied without a meaningful process to appeal in the name of national security. And thus our recommendation is that DHS should end the use of CART and other USCIS security vetting programs targeting individuals based upon their ethnicity, nationality, or religion, and they should also provide a meaningful redress mechanism for those cases, those whose cases have been pending for extended periods with USCIS due to these vetting programs. So this was, I want to remind folks that this was raised, I think, at our very first in-person meeting at the issue impacting a lot of members of our community. And it's taken us some time to get information about how it's impacted. But here we are with the recommendation.
Thank you so much, Bryce.
Do we have any questions from other commissioners? Lisa?
Yeah, I'm just wondering, if you had any discussions about Korean adoptees. I'm just bringing it up because I got a letter from Nakasen, right, where they're, and I think they sent it to, I want to say Erica and to Crystal, because there's some legislative thing going on to try to address Korean adoptees who weren't citizens. They were adopted as babies, they thought they were citizens, and they go to college and they're not citizens and threaten with deportation.
We have, gotten that letter in the committee and have discussed, the question of, what can be done administratively versus legislatively. And so that's an area, but that I don't think is specifically related to the CART program, but it's a different issue, but related, but
I
not.
just want to
not-
flag.
okay. Eric?
Oh, thank you very much, and thank you, Commissioner, for this very important recommendation. I was curious about the intersection of the utilization of community-based strategies in the implementation of this kind of recommendation. How would that happen? Because there are some very effective organizations such as the Asian Americans Advancing Justice. And so I'm wondering, okay, how would these community-based organizations get involved in this kind of effort?
Well, the recommendation is specifically about ending this particular, extended vetting program that, is specifically targeting people because of their religion or nationality or ethnicity. The recommendation goes more to, doing an equitable, fair process and how security vetting is done. And so to the extent that community-based organizations may or may not be involved. I think maybe about community education for folks that might be impacted and for folks that are, you know, I mean, some of the folks that are impacted by this program have been waiting for years and years and years and just have no resolution in their cases. And that is, like, hopefully they're connected to programs to, you know, be able to get access to legal assistance, for example, but I don't know, this recommendation goes specific to DHS.
Thank you.
Any other questions or comments?
So we have a second recommendation from Dr. Underwood.
Good morning again. The problem statement number 2 for the second recommendation. The deferred action for childhood arrival, more commonly known as DACA, provides temporary immigration relief for certain individuals who came to the United States as children who do not otherwise have immigration status. Since attempts to phase out the program in 2017, DACA has been subjected to ongoing litigation which threatens the safety and stability of DACA recipients and DACA eligible. So the recommendation coming from there is if DACA is terminated, the Department of Homeland Security, DHS, and the administration should adopt solutions to ensure that DACA recipients and other undocumented API individuals who have resided in the United States since they were children are not under threat of removal from the United States and should be able to continue to work lawfully. Such solutions could include, but are not limited to, temporary protected status, TPS, deferred forced departure, DED, and other parole processes that would ensure the continued safety and stability of DACA recipients and DACA eligible individuals until a more permanent and legislative solution.
Ajay?
Thank you. This is a great recommendation. I think we all wanted to support it. Of course, I'm part of the immigration subcommittee. I didn't bring it up earlier, but I was wondering that there are kids who have been part of aging out because so would they are aging out and they lose their status because their parents are looking for backlog, and they sometimes call them as DACA kids. Would that be appropriate them to be also a part of this recommendation, or that should be separate?
Well, as you know, we already made a recommendation about that topic in terms of non-aging, you know, having age out protection, but I mean, I think the idea really is for, like, the recommendation is broad enough to cover folks that, you know, they've been here for a long time.
Thank you.
Kimberly?
Yeah, thank you, Kimberly Chang. Thank you to the subcommittee for making this recommendation. It's really needed. These young adults now are in the workforce. Many of them are doctors and nurses. We just heard that there's a big shortage of these professionals. And even if they're not in the healthcare workforce, they've been here and they're contributing to our society and our community and the fabric of America. So I really appreciate this, and I want the folks who are under the DACA program to know that we are thinking about them.
Thank you. I'm going to turn to one of our commissioners, Diya TV, who's online.
Thank you so much. I also want to send my appreciation for you all doing a recommendation on DACA. But I also want to point out, and this may be something for us to collaborate with on, is that there was an executive action on DACA recipients being able to utilize the ACA for medical insurance. That ruling executive order has not been implemented yet, and it may be something that the immigration subcommittee and the health subcommittee want to work together on to see if we can continue to push that along.
I think we would welcome that.
Thank you so much for that update as well, yeah. Seeing no other,
I just wanted to flag in rereading the recommendation, I just have a slight copy edit. A couple words, but can put in there before continuing. So. That's, I'm looking at my fellow.
line is up, which line?
So on the fifth line down. Just putting in can before.
Okay, great, we'll include that before we vote.
Actually, make Kevin look at it and make sure the words are.
So the only change I hear is the one that Grace had suggested on inserting can before continuing in recommendation number 2. That's correct. Okay, great. Okay, and we will move to our last subcommittee presentation from language access, and I will turn it over to Kimberly.
Magandang hapon from my commissioner sitting to my right, Teresita Patayola. I am co-chairing the Language Access Subcommittee alongside of my compadre here, Victoria Huynh. Our members at this time are Simon Tang, and our ex officio member is Laureen Lagwagaron. Our DFO is Erica Ninovi. I'd like to thank our previous commissioners who have since rolled off of our subcommittee for all of their great work. We previously had submitted 16 total recommendations to date. And so it's to these former subcommittee members, I extend a lot of gratitude. Grace Wong, Dr. Kamal Fassi, Dr. Amy Albayani, Ajay Victoria, and Carrie Doi. So thanks for leaving us in the dust. Just kidding, don't carry your spirit. Just kidding, there was this all the time. All right, our priority issue areas are to increase outreach and engagement with communities with limited English proficiency populations, to improve language access funding for healthcare to serve limited English proficient families, to prioritize and expand federal funding for AA and NHPI language access, including translated communications. We also want to address the needs of lesser diffusion language groups in the United States, including language preservation efforts. And I especially note this during this month, Mahina Olelo Hawaii, which our executive director, Crystal Kai, noted, which is Hawaiian Language Month. We also want to support federal agency efforts to update and strengthen language access implementation and strengthen training and accountability for federal grantees. We had 2 presenters who shared their expertise with us during this time period. They included Glenn D. Malkante, Commissioner with the U.S. Commission on Civil Rights, who presented on the 2022 statutory enforcement report on the federal response to anti-Asian racism in the United States, as well as Stephanie Wong, Special Assistant to the U.S. Commission on Civil Rights. I'm going to turn it over to my great co-chair here, Victoria Huynh, to discuss our recommendation.
Thank you, Commissioner King. Victoria Huynh. I just wanted to say Happy New Year, Lunar New Year, and happy Hawaiian Language Month and happy Black History Month. We have one recommendation to present at this meeting, and our problem statement, as you see,
limited English proficient Asian American, Native Hawaiian Pacific Islander communities. That the President's Advisory Commission on Asian American, Native Hawaiian Pacific Islanders, or PCONPI, serves are unable to access the materials, engage in commission meetings, and participate in discussions and summits. I know we have probably had some language access opportunities in some of our meetings, but not all of our meetings. But this recommendation specifically speaks to how the LAP communities engage or with our work. And so maybe I'll speak a little bit about the background and rationale and speak on things that we probably already know, but need to also make sure that we uplift in these meetings. But over the past 2 years, our commission has produced a number of recommendations. I think we've heard 70 so far. 16 specifically with the language access subcommittee. There's been a lot of discussions, right? Fielded questions via the Federal Register, convened a number of economic mental health summits and community engagements. This commission should lead efforts, right, to provide language access. And we've heard many language access related recommendations kind of sprinkled throughout many of our subcommittees. And we need to include the limited English proficient communities that we represent and demonstrate feasibility to the executive branch. And in the US, 68 million people speak language other than English. The total population with LEP is 26 million, and the largest language group with the LEP is Spanish. The next 4 largest language groups with the LEP are of Asian languages, and that includes Chinese, including Mandarin, Cantonese, Vietnamese, Tagalog, and Korean. And that doesn't include many of our other languages of lesser diffusion. And nearly twice as many people with limited English proficiency live in poverty compared to people who are English proficient. And nearly half of adults with limited English proficiency do not have a high school diploma. And immigrants with limited English proficiency are more likely to report poor health than English-speaking immigrants. Californians with LEP limited English proficiency are 3 times as likely to lack access to internet, and 1/4 of this population has no access to a computer. So furthermore, this is a priority of this administration. Obviously, on day 1, President Biden signed the Executive Order 13985, which is also known as the Advancing Racial Equity and Support for Underserved Communities through the federal government. And that instructs agency to focus their civil rights authorities and offices on the emergency threats, and that threat is on, for example, language access barriers in our communities. So taking us to the recommendation, we have a few bullet points here. The first one is that the final 2024 commission meeting be presented and accessible through simultaneous oral interpretation of recordings and written translations of meeting materials, including but not limited to the top 3 AAPI languages, including the Olelo, Hawaii, to promote language preservation efforts. We also need to explore public-private partnerships to fund this activity. And the second part is that the final commission report to be available in at least the top 3 ANHPI languages, including Olelo, Hawaii, so that ANHPI communities and respective ethnic media, community-based organization partners can access findings and report out to various populations. WIOMPI explores, again, public and private partnerships to fund this activity. And last but not least, future President's Advisory Commission on ANHPIs should include planning, budgeting, and public-private funding to ensure that the public commission meetings are accessible through simultaneous oral interpretation, recordings, and written translations in at least the top 10 ANHPI languages for both interpretation of oral meetings and presentations and translations of written materials, including the Olelo Hawaii language. That concludes our recommendations. I'd love to hear your comments or questions. Teresita?
Yeah, Teresita Monteola. Thank you for making this recommendation. I think it's especially important that we memorialize our work in a way that's accessible to our communities. My comment is, I think 3 is pretty limiting, especially if it includes the little Hawaii. I think we need to take a look at that number, especially in the exploration of public-private partnerships. And not hold ourselves to such a low number to make sure that we are indeed inclusive of our communities.
Kevin Kim, there are 2 things that I just really appreciate and love about this recommendation. The first is that it's putting a mirror to our own commission, and everything that we're asking the other agencies to do, we're holding ourselves up to that same level of expectation. And so as I was reading it, I was kind of like, wow, this is something, we only have a certain finite period of time left on this commission, but it's something that to keep in mind for us as we go forward. So I really commend you on that. And then the second thing I really loved was the public-private partnership reference here, because I think as much as we want certain things to get advanced, we know there are limitations on resources, and sometimes that may eventually happen, but by adding this additional aspect of the private partnership, hopefully we can get funding to speed up this process. And so that angle, I really, I don't know if that's the first time I've seen it in any of our recommendations, but that also too is something that I think all of us should think about more. So thank you for that.
Thank you. Lisa, did you help your?
We'll talk about it in the strategy discussion.
Okay. Harry?
Oh, Terry Doy, I too really love this recommendation. Similarly to Commissioner Kim, I really like the idea of public-private partnership. But what I was wondering about, though, is that would that complicate matters in getting things done in mixing both public funds with private funds? Would it inhibit us? Might that tie our hands? Would it make us more flexible? I guess I'm looking to the DFOs to answer that question.
Answer that question. So right now, I will say the challenge we have is we have a finite budget, and I think this was alluded to earlier. We don't even know if we're gonna have funding past this Friday at this point. The Congress needs to fund and appropriate funding. And so the challenge in general that many federal agencies have is that they don't have dedicated funds for language translations. And we, through the initiative, just recently brought on a language translations contract, but even that is finite. So to do, you all meet for, I mean, we're looking at an 8-9 hour meeting to translate even into one language. That's very costly. Do it into multiple, like a simultaneous oral translation that's costly. The same with the written, right? So I think a lot of it is the budget constraints, and that is why I do think this idea of public-private partnerships, there are different gift authorities that federal agencies can utilize. We don't know, we have not actually done this in the context of translation services, so we would have to explore what is possible more administratively on our end. So I can get back to you on that, Carrie, but I think just in general, a big challenge for a lot of agencies, including for our initiative, is the lack of funding. Even if we have some funding dedicated, we have to be judicious with how we use that, and it is costly.
Grace? Yeah, I was just gonna bring us back to a recommendation that we had made earlier on from the language access subcommittee around, trying to push the administration to actually budget for, agency budgets for, a certain percentage minimum for language services and interpretation translation. I mean, it's like that's where we're going, and who knows where the recommendation is at this point within, the federal government, but I feel like we got to start somewhere, and that's an element of it, as well as pursuing private resources as well. It's back to that. Victoria?
Yeah. Victoria, when we are definitely acknowledging the comments that it may, right? I mean, put 5 languages, is it 10 languages? And there are so many other languages that are not, under that top 10 in our communities, especially the languages of lesser diffusion.
But, you know, I echo what Commissioner Hahn said. I mean, we have to start somewhere. And I think we need to walk the walk, right? As we're advocating for our federal agency, but also noting that there hasn't been allocation, right? Or significant or sufficient allocations for many of the agencies, including the LP. And I think we just wanted to make sure that we state that and note that. But we are also looking to the future. So our recommendation does talk about future commissions and making sure that the allocation of funds is there and readily available for many of our needs. And I also wanted to just make notes. You know, I know we have our chief commissioner and deputy commissioner that is, you know, in and out of our commission, but also want to acknowledge Sarah Min's deputy commissioner's role in supporting the work and specifically the conversation in this recommendation.
Yeah, I really appreciate Deputy Commissioner Sarah Min because she was our fairy godmother in our small but mighty team after Carrie left us. One thing I wanted to say about to address Commissioner Bateola's point, we agree 3 is not enough. We also know that this was not in Riafi's budget. And so that is why we put in the 3rd bullet point that the future commission should include right off the bat, planning, budgeting, and the funding for ongoing simultaneous interpretation. We also wrote that we wanted at least 3, and I think in our subcommittee meetings, that seemed to be a stretch number that they could try to go for, but it's not limited to. So if we are able to find additional support, maybe we can have additional languages. So I just wanted to put that out there, just to respond. We did have robust discussion around that. What is practical, what is doable, and then going forward, how are we gonna really support the future commissions?
Thank you.
Kelsey, I just want to respectfully push back against the concept that, you know, budgetary constraints hold us from really doing what is right, because you know, we can spend trillions of dollars on war and weapons, figure out, you know, a little bit of money to get information to those communities that have been disenfranchised by not having language access. So look, it's going to be inefficient. The first cars were inefficient. The first rocket ships were inefficient. Language translation will be inefficient until we do it as, you know, as an everyday process. So maybe we can utilize AI, we can use public-private partnerships, but it has to be done.
I think we set the bar high. Really do.
Sorry, Louisa.
Yeah, so I agree with Kamal, it's kind of right, but I really do agree with Kamal that if we don't set the bar higher, we're never gonna get the participation that we need from our communities, because we're just gonna continue to grow. And, you know, I think we set the bar high and we push and push and push to make it work. But, you know, I had to deal with it as a national officer of the union because of all of the languages. And let me tell you, people demonstrated when they didn't get to hear it in their language. And just imagine what people who would probably want to be watching us, but they can't because it's not in their language, right? So I think we just set that bar high and just push it. Make it comfortable enough that people are gonna take notice. Because we can't be just a checklist. Like, okay, we got that, right? We're gonna translate it into Cantonese, right? But we have to set that bar. And then hopefully the commissioners that follow us will be able to follow through this. I'm not saying it's gonna be easy, it's hella hard. to do that translation and to get the nuances right. Right, it's really hard, right? So I'm respecting the volunteer.
Victoria. Kevin?
Oh, so, Kevin, Tim, so Louisa, on your point and Kamal's point, I think what's gonna end up happening though is that, not though, I think what's gonna end up happening is that AI really will come into play and help. I think the missing component is what we've seen is that once you translate the language over, you need still the human eye and like you said, to get the nuances. And I think that's where the nonprofit organizations, the CBOs in our communities and our different ethnic enclaves, they need to be engaged in this. It's a way to also support them. And frankly, it's a lot cheaper to utilize them than it is to utilize a for-profit language company to try to do all that. And they don't do as good of a job. Exactly. So I feel like at least, you know, that I like the recommendation that future commission reports have to be done this way. And I think just having that mindset now, it'll be a lot easier and more cost effective to actually get it done.
Victoria.
Yeah, and I know there was a lot of conversation and, what would this look like and, which communities would not be included? And how can we include more communities? And so I think what I, just kind of sat with is maybe it's not just a recommendation, but a phases, right? Phases of the strategy. But phase one is we roll this out in the way that we've recommended in this recommendation, but knowing that it is not enough. But going back to a part two strategy of this, right? And, building up the resources and actually, now we're calling for an allocation of funding. So what would that look like when the allocation does hit? And then how do we roll it out? But also knowing what the current resources are, it's not there. I mean, obviously, but there's many recommendations that have spoke to the allocations of funds. But now we're just looking with them, right? We're looking within our commission and part two is what are the languages of classification that we want to target? And are we matching with other federal agencies that have been doing it well, right? Census has it been like 15 plus languages. And then how do we mirror those that do well? Department of Labor, for example, I know we've highlighted what the Department of Labor has. So just wanted to think that has been all still continuing that conversation.
Thanks, Victoria. I'd like to turn to Mia online.
Yeah, I'll be real quick. Just adding to this, the disability community has pushed for language access for a long time, and we're able to get ASL, as a lot of folks can see on this call today or on this meeting today. So I think it is possible. It's about where do we prioritize our dollars and which communities we prioritize. So I think it's, we often quibble about money. I think it's just learning to show through our dollars that we prioritize communities that are often left out of conversations. And I think also just a reminder that we did, Kimberly did actually write a recommendation on the concerns around AI and language translation. So want to keep that in mind as well. Thank you.
Thank you, Mia. Lisa, did you want to?
Yeah, so I think we should take Kevin's recommendation to use or work with community-based organizations, because the professional organizations that translate papers, because we've had to translate stuff in Tagalog and it's like way over somebody's head. Doesn't even make sense. And so we have to go, to the community and say, read this, does it make sense? And they would tone it down. Especially with difficult languages, right? They just didn't have the language like in Cambodia. Like we utilize the Cambodian organization that said, help us out here, because we have to get this out. So that would be a great partnership, with the community-based organizations.
Are you suggesting that we include in the different bullet points that where it says the explores public-private partnerships to fund this activity, including community-based organizations. And all of these in the three bullet points. Is that what you're suggesting?
That'd be good.
I think you have it on the second bullet point. For the report.
That's for accessing the findings and reporting out dissemination. But are you suggesting that the community-based organizations do the interpretation? Or translation?
That we don't just look at the private sector, but we take a look at those community-based organizations. We day in and day out have to translate the material because they've got their expertise.
Does that get into contracting or how?
How was that?
I'm guessing that this is gonna be there's two conversations. My guess is here, one is what can the US government do? Because there's gonna be a set of like requirements of how the US government gets it through contractors and it's appropriately done. There's sort of the question you're asking, which is slightly different. So maybe there's a question here of the API explores public-private partnerships to fund this activity and work with community-based organizations for dissemination and translation. Right. I'm sort of parsing words here, but parsing, so it's not just the US, if the private sector, the public-private partnership does it doesn't always have to be under the US government.
Yes.
Yeah.
I think that is.
So however you think it should be worded, I'm not so clear of.
But I think that'll get to your point, but I just want to make sure we get the, I was just get the concept. Okay. I might be all the way
So if we're doing some editing here, I still do want to get back to the top three. The language here says including but not limited to. I prefer minimum. And the way I interpret this too is top three is just two, because you've added Olelo or Hawaii. It was that the intention. So, and then I like Sonal's suggestion. So I think that is a part two of the next sentence. Because the first part talks about funding the activity through public-private partnership. And then we can include the phrase about dissemination piece. Working.
Can I make a recommendation on your language then to say, including but not limited to top three AA and HPI languages as well as? So that's the 3+. Does that make sense?
So then it's 4.
Yes.
At least.
Yeah.
At least, yeah. So it's just saying the top 3+.
Yes.
Yeah. So I think that gives us the.
How about the,
Did you have a?
yes, how about the sentence about the community-based organization? Did you get that?
We did.
We'll add it to
Would be-
all of the.
Yes. Thank you so much, the language access subcommittee. Spontaneous now.
There's no seat at the table for you.
Okay, I think that concludes the section on, Perry wants to rejoin the committee.
I hold the committee members in very high regard. I just wanted to just throw out that food for thought, and that I guess the nature of my question was when you commingle public and private funds, then lawyers start to go crazy. And so what I was thinking about is maybe to seek guidance from HHS's OIG to say, what would that look like if we were to bring in private funds? Right? You know, and I don't think it has anything to do with the recommendations. It's just at the logistics of how we would work.
Yeah, we'll do that, Carrie. It's actually, it'll be a mix of our kind of our global council ethics and then also other components. And we do have gift authority we can leverage through the federal government more broadly. So even if HHS does not have the authority, we have utilized other members of our federal interagency working group to do that. And I think the economic summits are one example of that. We have leveraged SBA's gift authority to have public-private partnerships there, including funding for items related to support those economic summits. So we can similarly look into what's possible and how we split that cost. So absolutely, Carrie, we'll do that.
Thank you, Carrie. Well, that concludes our recommendations. Thanks to all the subcommittees for all your hard work in preparing for these recommendations. And with that, I think we will break for lunch and we will come back here at 1:30 to all those joining us on live stream. So commissioners, please, just as a reminder to remain in your seats until the live stream will pause. Thank you, everyone. Welcome back, everybody, and thanks again for joining us on the live stream. We will pick up where we left off and go ahead and vote on the 7 subcommittee recommendations that we just heard from earlier. We will go through each recommendation, and if there are any edits to any of the recommendations, we will review those as well. They will be highlighted in red, and then we will vote on all the recommendations as a group. So, starting from the first recommendation from the belonging subcommittee. There's an edit on page 2. And you can see it highlighted here in red to delete the word more from the first line and to insert the word blue on the third line. Does anyone have any questions, comments? Thank you, Kevin. So we'll vote on this recommendation. Do I have a motion?
So second.
All in favor?
Yes.
And please take your hands up so that Judith can mark everyone's vote.
Aye.
Okay. The commissioner, just as a reminder, commissioners that are not present for voting include Daniel Day Kim and Smita Shah. And we have Mia Ives Rubley and Reynolds Samoa on online with us for voting. Thank you for joining us. Okay, we'll move to the second recommendation from the Data Disaggregation Education subgroup. I believe there were no edits on this recommendation. Making sure there are none. Do I have a motion?
So
Second. All in favor? Aye. Dr. Smo, if you want to vote using your, thank you. Excellent. Okay. Third recommendation for voting, the Health Equity Subcommittee. Recommendation 1. No edits. No edits. Do I have a motion?
So move. Second.
All in favor?
Aye.
Unanimous. Recommendation number 2. Also no edits. Do I have a motion?
So
Second. All in favor? Unanimous. We pass, and we will move to the Economic Equity Subcommittee. Oh, that's right. No recommendations were presented, so we'll move ahead to the Immigration and Citizenship Status Subcommittee. Recommendation 1, no edits. Do I have a motion?
So moved. Second.
All in favor?
Aye.
That was unanimous. Recommendation 2. We had 1 edit. Delete the words "to be able" in line 5 and insert the word "can" continue. Does everyone approve this change?
Yes.
Okay. Can I have a motion?
So moved. Second.
All in favor?
Aye.
Unanimous. And we have the Language Access Subcommittee recommendation. We have a few edits here. We inserted the words "as well as" before and deleted the word "including" before in Alela, Hawaii. And we added the phrase to the last part of the paragraph that says, "and work with community-based organizations for interpretation, translation, and dissemination." Teresita.
I think we need to delete, after including, delete in.
Oh, yes. As well. Oh, no, I think you said it. As well as in.
Yes.
In Olelo, Hawaii, Hawaiian language.
Why in?
In
So we want Olelo Hawaii to be included. So as well as Olelo Hawaii.
As well as in Olelo, Hawaii.
But it's referring to the language.
As well as in like that side.
Oh,
Olelo means language.
Why?
okay, so I was thinking. Okay, I was thinking of it as a language rather than in, so I don't say in Chinese when we're talking.
Oh, after the Southern Hawaii.
I think the last verb is written translations in Oleo, Hawaii. That's why it's like in Chinese, you know,
Yeah.
because you're talking about the written translation of
Got
meanings
it.
in Chinese.
As well as oral interpretation.
Right? You wouldn't say written translations of meeting materials Chinese.
Okay, thank you.
Okay. So the same changes are in bullet point 2, as well as deleting the word including and adding and work with community-based organizations for interpretation, translation, and dissemination. Can you go to the next slide? And then the third bullet point, we inserted and partnerships with community-based organizations. And also included as well as. Does anyone have any questions on the edits that we collectively made? Do I have a motion to approve?
Second.
All in favor?
Aye.
That concludes,
That's voting.
We're late voters.
thank you. Thank you, everybody, and thank you again for all the critical recommendations that were presented. We included the voting portion of the recommendations.
Have we done data dissemination yet?
We did, so, there were no changes.
Okay. We're gonna move to the second part of our meeting now that we've finished the first part, which is each of the subcommittees plus recommendations. We're not gonna go into strategic planning. As many of you know from our last conversation, this is about sort of the final report and how we want to structure and do the final report. We have a plan that we're going to talk about today, as well as one important thing that we want to talk about is the themes, what the theme of the final report will look like. We have collectively, well, Sarah and I have appointed a writing subcommittee that will help pull the themes together. We'll write sort of a summary, opening and a summary for the closing. So the subcommittees will do a lot of the work in terms of what needs to each of them that help put that together. Our committee is Grace, Kimberly, Victoria. I'm looking at the two of you and I'm like. But first of all, I want to say thank you to the three of them for willing to take this on, because it's an incredible amount of work, and I really appreciate the work. We'll be there. No.
Good luck.
No, thank
We
you.
have our 2 fairy godmothers.
Thank you for doing that. I think the thing here to think about is, remember, unlike the other commissions, we have been doing rolling recommendations. So majority of the reports in the past have been very long because all of the deliberations and everything's put into one report. And that report was very long. I think what we would like to do here is make it concise with clarity as to why we did what we did, what the themes were. We'll talk through the themes, but also, and some of you already started the themes. What do we want to leave the next commission with? So how they might get started from based on the work that we've done and the way that we were able to be based on what on the past commissions and what has been done there. So we have quite a few things. We had actually a very robust discussion at the last meeting about the various themes that we could have for our report. And I think in the broadest sense, in the broadest sense of those themes, it was community-centered preparedness and resilience. And this is just really a reflection of how the commissions are centered and how we approach the work. Our intended audience again was the public. It is our community. And so what we will need is a narrative that we'd like to convey and highlight, why these recommendations and policies were important. Why was that important by you, and how were government resources deployed? Now, they may not all be deployed, but how we were asking for government resources to be deployed. Saying that, I do think it would be valuable, Crystal, and I don't know if this is really part about this, but is to think about what is already being done, so we can see that this is a parallel effort, and I think it's good for the public. So here are some theme ideas, and I'd love to open it up for discussion. It's, again, this is something values-based, equity, justice, and opportunity aligned with the executive order and the themes, advancing equity, preparedness and resilience, anti-nation, hate crimes, and primary and secondary prevention. These are some ideas for overall themes. Want to open it up for our own discussion in terms of what would you like? Let us take in the information that will help us and the subcommittee, the writing subcommittee, to really think about how to pull draw together the commissions, what's each approach we think and the theme. And I've been asked to speak up, so if it sounds like my voice just got louder, it's for a purpose. It's not to yell at you. Thoughts, ideas? Yes, please.
So I think our writing subgroup met to just review some of what was discussed at a lengthy and robust discussion in October. And what we felt surfaced was this idea of community-centered preparedness and resilience that actually some of our now departed commissioners have brought up based on events in climate or in Hawaii. Jen and Michelle, who rolled up the commission, had brought up a lot of these topics as a parting gift, I think. So I think, our challenge is, have we centered, asking ourselves now, have we centered the community? Have we thought about, and I was thinking during the recommendations today, that we are really talking about proactive support and recommendations in order to create the kind of independence and resilience that our communities can have in a forward-facing, future-facing position. So I just to give you a little bit of background as to how we came to this sort of draft idea of was really collecting everybody's voices from October. Does anyone have, so as someone said, to open up for discussion, or we could even point to specific recommendations that may speak to this theme?
Sure. I mean, I think it's great that you started off with like purpose and identified what are we trying to do with this report. I want to be able to hand something off that will be a guide for the next commission. We want it to be simple. We want it to be read. I think these are great goals of purpose. But aren't we already organized in sort of like the subcommittees, which the themes sort of largely fit? And I think I guess you could create larger themes to say, hey, this is what each of these we're trying to do each of our subcommittees are trying to organization, we build but I think the larger issue becomes who's going to read this report? You know, is it really intended for certainly the commission? Most definitely. But will it get to the community service organizations? Will it get to just regular people as perhaps a guide? Or do we just intend this to be something that sits on the government shelf? Why not turn it into an interpretive dance and music routine? I joke about that, but you know, we should think about a way in which we can make a report that'll be, I think, broadly seen and digested by our and Ajay, if we do an interpretive dance, Ajay can volunteer. And Simon.
I was thinking of something that Victoria said, I don't remember if it was in a subcommittee or in a writing subgroup of how our recommendations are often a guideline and a support to the work that other CBOs have been doing for decades and continue to do. And so I'm just speaking on my own larger discussion to your point, Kamal, that what do we, I think it's a great question, you know, what do we want the people to take away? And I think it's almost like a tool that helps support the work that many CBOs are doing and also like sheds light to people, especially the underserved in our community, to understand some of the issues that they should be caring about.
Can I add to that and just say, I think take it up a little bit and then say like the framework that we provided here, and it's more or less a framework, even though we have real recommendations, it's a framework in which others that want to push for other ideas have an ability to go and say, hey, the commission provided this. Under that, we think these things are also important. So it just provides a framework in which communities can go and take the ideas. So let me answer two questions to add to that. The broader question you asked about the why, the overall theme versus what we've already been doing. I think it's always helpful to have a broad theme of how we approach the work. And there's the subcommittees of what we did, and everything within the subcommittees is an approach to the work. Right. And so what was the approach we took? What was the framework we set out? And that allows people to have the read the data that carry on. We're just about one at a point in time. And what we hope people will do is take that point in time. Ajay.
Before I speak, one clarifying question. On the template, we have appendix C, which is the recommendation summary document. Doesn't mean it will have all the detailed recommendation, all the details. Great, thank you. So with that, all the details of each recommendation already included in the appendix, which means that anybody in the government or community is reading, they will get tips of every recommendation, 70 plus recommendations, they will get a list of those details. So that is taken care of. Then coming to page 4 and 15, that's where we're talking about, you know, how we group them together and what should be included. I think the framework which you mentioned are talking about Sonal could highlight each of the subcommittees, you know, this one page, what we have been talking about that in economic subcommittee, we were talking about opportunities for small business, access to jobs and training, workforce development, something, all these broad themes. We group them together and say, this is what our thought process was. We are focusing on small business, workforce development and all this, whether it's a form of an essay or one-page bullets or point points, that could be decided. Yeah, I mean, but
So can I pull you back for 1 second, Jay? And we will get to that piece of it, which is what each of the subcommittees do. I want to just sort of bring us back to what's the overall theme of our mission. I think that's the sort of the proposed idea, proposed theme was community-centered preparedness and resilience. what I would love is just some feedback on that. Does that make sense? Are there other ideas on what we should think about? Like broadest report, but think about it like if it's a scaled version of it, at the highest level, this is what our commission came to do, and then these were the things what we did within that. So
What was the word you used?
community-centered preparedness and resilience. It's not in there.
Okay.
Let me just put that as an idea.
Yeah,
But there might be other ideas, and we're putting it out as an option to think about.
so this is basically why we are doing this.
Yeah, that's.
Yeah.
Yeah, at the top.
Or how we approached it. That's, when we came to this commission, this is what we aimed to do. But it's just that like our goal was a stronger community, more community-centered preparedness. It's just a question. I put that up there. So sorry, I didn't mean to cut you off.
No,
What
no.
you were saying. We will come to that, but I just wanted to. Reynold?
Thank you. So just to go off some of your comments about the framework, we were given examples of recommendations by other groups, other federal groups. Most notably, I think one example came from the Health Equity Task Force. And you know, their report was formatted for government agencies, but the narrative was centered around community. You know, and I think that's why the report was a little bit easier for non-government people to digest, because even though, you know, the recommendations were advocating for community, the community knew why. You know, they were speaking directly to the disparities that were happening, like in real life and on the ground. And I don't have a problem with like community-centered preparedness and resiliency. But I feel like there's something missing in that framework, in the narrative. You know, I think within preparedness, there's a gap. You know, I think part of like voicing our commission's purpose is the need. You know, like what is it that our voices were brought together to talk about? I think that helps center what our communities are facing, because this is community-centered preparedness and resilience is all about reaction, but there really isn't sort of a through line in regards to self-determination, which I think is kind of something that we were talking about. The other thing too is, I think keeping within sort of the perspective, although this is for government agencies, how we articulate that framework, you know, are we speaking to the purpose, hope, meaning, and belonging of our communities, or is this purely sort of a descriptive report? All right, I just wanted to see how many times I can say framework.
How many times you can say?
Right. Yeah. So I appreciate what Reynold shared. And I think, you know, as we were looking at themes, and I know we're going to narrow down my wordsmith, but I think the essence of it, right? We wanted to center our community, and I think we've been doing that. And that's why I'm so proud of just the listening sessions that have come out with this commission, listening engagements, right? And kind of this centering of how the community is going to interact with federal agencies beyond the White House and so on. So I know the words will change, but I think, like, how do we capture the essence of that, right? That we are, you know, I think in every single way, all the conversations that we've had has always been, you know, reflective of that. Like, what is the community saying? What about the languages of lesser diffusion that have not been brought to the table? Who is being invited to the table? And so I like the community science part, right? And of course, I get what you're saying, Raynard, like there's maybe something that's missing with the narrative piece and with the voices of our communities. And then there's also this question of like reflecting on whether we have done that,
I know our commission term has not ended yet, and I know we still have time to catch up, and I think there's some intention about noting that, but also reflecting on whether we have done it to the best of our abilities in the time that we have, knowing that we still have, you know, a few months before the end of our term, and then how do we address that as a executive commission? Just want to understand that in the discussion. Kevin?
Kevin Kim, I think the overarching theme for me has always been equity. Just a simple word, but I think two of our subcommittees have equity even in our subtitles, but everything else about and the difference between equity and equality, right? It's, I think as Asian Americans, we haven't just wanted to come in and say, you know, treat us just equally as everybody else in the sense that when that happens, we often get placed into this minority myth cycle, and there are things that happen along the way. And I think we also want to be seen as a community that has needs where the equity piece kicks in, where you want to address the community specifically for what its needs are in order to get us to that place of equality, right? So I make the distinction between equity and equality. And so for me, whether it's anti-Asian hate crimes too, it's, you know, it's like, why are we getting targeted? And why is it that our small business community that make up a disproportionate number of small businesses within many of the major cities, but especially within our own community? So if you take, you know, a particular community and it might be X% of the entire small business community, but then they look at Korean Americans, for example, and then within that community, it will be like a majority of the business owners, small business owners. So in terms of just understanding that there's a piece of equity that's always been missing for the Asian AA and HBI community, and that what we're trying to do here with all of our work is, you know, equity informed by our community. So I would kind of put that big theme as equity informed by community. And that's how I kind of feel like everything ties back into that. Everything that we're talking about, every recommendation we're making is wanting to be heard.
Yeah, thank you, Victoria, for clarifying that. I think when I hear the word community preparedness alone, it didn't inspire me because I feel like the community is very prepared already. And I have, when I talk about our commission, I always say to ensure that the federal agencies are more inclusive of Asian Americans, right? And so I feel like we are the bridge for the community to understand how policies impact them, because a lot of times our communities are very resilient, but are very isolated in the local community and have a very difficult time accessing even their local government and, you know, the federal agencies, right? And so I really feel like, I don't know what the theme should be, but we really have to lift up the power of our community too in the work that we're doing, and that they have already been doing a lot of this work, which I hear you acknowledge as well too. But really to put that in the forefront, that we're just an extension of our community, and our community is powerful when we actually include them, right? And that we are that bridge, but you know, it's really to the federal agencies, the government. So how do you talk about it in that way so that there is a sense of empowerment, right? Additional empowerment in our community, so that they don't feel like, well, who are these people to come in now and thinking that they represent us, because we don't. I mean, I am still very concerned that we don't have enough members in our community who are engaged with us. Again, Victoria, you said we still have to reflect on that. And there's a lot of different kinds of challenges not related to us, but we need to get over those barriers as well too. So I would say the themes are important, but I want to be very mindful that we're not, underestimating the power of the community, and that we really leverage their power. But how do we add to that power to ensure that they continue, whether we are in existence or not, whether the next administration continues this commission or not, that the community always has that access, right, to each of the federal agencies and the voice at the national level. And I also feel that in some ways, I want to say this should be a call to action, right? For not only the federal agencies, but all of us to continue to do this work in our own siloed communities, you know, how important that is. And we were just talking about how when we think about policies, the policy we do is behind closed doors. Our communities understand what we're doing, right? And even when we do, even when we're successful, you know, we can't attribute it to ourselves because people didn't know that the numbers of meetings that we've been at, the many different leaders that we have met. And so all of those things are, I think, need to be more transparent and need to be shared with our community so that they can do the work even when we're not around. You know, so for me, I've been thinking a lot about your request of us. What is our legacy? You know, and that legacy is that I can't just be the only one at the table, right? And how do we get more people at the table? How do we get more of you out to the communities? So it's still an answer for me, but I'm really happy that you guys are thinking about this, and having the word alone is not enough for me to understand, but I hope that that's what you think about.
Well, we're thinking about it together, to be fair. We're thinking about it together, to be fair. I think this is, I think there's a drafting, but the input is all of us. And so I don't think, please don't see the drafting as part of us doing it, providing input. It's a both thing. And the final report will be in contact for everybody to approve. So I think the input's all this. Kimberly and then me.
Okay, great. I agree that this report or this executive sort of summary is for the community. Because I see the recommendations that we've been doing on a rolling basis and the meetings that we've been holding, those were directed at the executive branch, I think. And asks our recommendations and suggestions for them. And so this is sort of, to me, what I think it is sort of bringing it all together to really explain what we've done and why. And I don't see us as being the only ones at the table. Because we've always been, all of our subcommittees have been so intentional about asking community groups, so many communities to come and share with us what they need. And our job was to sort of translate them into policy bonk speak, as well as we could try to do that from all of our experiences and different backgrounds. And so, you know, it was us working together with the community. And so I kind of think that it is also a document to help build the capacity of the community going forward so that in the future iterations of this commission, hopefully there are more, they say, oh, this is what you should do. This is how you can be involved. And you can actually come and talk to them and give your input, either written or orally, or ask to be invited or reach out to any of the, you know, commissioners or the White House initiative. And I think that is slowly building. I think people are starting to understand that. So that's kind of what I think it is.
Mia?
Yeah, I was reflecting on some of the conversation around sort of themes. And I think one of the things, you know, resiliency and empowerment are great. I think it's just that it leaves out sort of puts the onus on our communities to like dig ourselves out. And I feel like we should be also talking about breaking down barriers because and directly addressing that and not just saying let's build more resilient communities. I think it's both. It's, you know, making sure that resources are getting to our communities so that they can become more resilient rather than, you know, just like, oh, let's build resiliency, et cetera, or empowerment. So, you know, like I don't want it to seem like we're saying our community has to dig itself out on its own, that part of what we are doing is bringing messages from our community that we're parts of to let folks know that like there are issues with and barriers that our communities are facing, and thus, you know, the government should be doing something about it.
Dr. Ardour?
You know, at the risk of just repeating everybody, there's some elements here that are really critical. One of the issues is that kind of hinted at it, where, you know, we're doing a lot of work beyond just making recommendations. So what we're doing is and it goes back to the term community voice. It's really voice, you know. So it's really about voice. And then what is the purpose of that? Now, that goes to Kevin's point. The purpose of that is equity. And so, you know, resilience kind of hits on that, but it doesn't really, you know, because equity gives it a brother. But who are we making recommendations to? We're making recommendations to a government. We're not just making recommendations to everybody. So it's like the payoff should be institutional action. Government did something. So it's like trying to find the words that kind of indicate the broader purpose, and then giving voice to a community, and also just kind of like reminding ourselves that we've actually made recommendations to a government. And so that, so at one level, there's going to be the desire to say, well, what's the payoff? The payoff has to be in the recommendation. And that the focus is, but there's something greater at work here than that as well. And that's giving community voices, and that giving them the hope of achieving equity in whatever way they see it, you know. So like Renan used the term self-determination, you know, that implies that equity, and equity is not the same for everybody. So that has a kind of a resonance to it, because you know, we're obviously we're hoping that community is bigger than us, that we're reflecting the community and we're giving voice to that community. But we're doing it for a larger purpose, but we're doing it through a specific course of action, which is government. That's who we're assigned. This is our current assignment. We're doing things like Kaying, we're doing things all the time, but our current assignment is this. This is our current assignment. So how do you kind of make that so that people see that? And I hope it's just not a list of recommendations.
No, we're gonna put the agenda up just so everybody knows what we're gonna talk about, what we are talking about, and then sort of what we will continue to talk about. And it is in your packets also. So I'm gonna keep going. Teresita?
Yes, to me, community-centered preparedness and resilience really falls under vision rather than theme. Also, resilience and preparedness, eventual, it's never static. And what we do in terms of our set of recommendations is to help bolster our communities. And to pick up on what Kevin and Kaim were saying, it's equity, it's uplifting our communities. It's also giving community voice. So I agree with Robert that we're a vehicle towards government. So it's making government responsive and accountable to very, very diverse communities, with multiple needs, language and culture undergirding these things. And that's the uniqueness of the commission's role. A role that no other advocacy group, no other singular community can do. And so I think that needs to be reflected in my opinion.
Lisa?
So I think it's a tough one. I really do, right? Because I get we're making recommendations to the government, but I also think about how do we inspire the rest of our communities to take a stand? Right, that a lot of good work is done, but it's also on us to inspire the community, right? Take a stand, don't be afraid, right? Hold your elected officials accountable. Right. And then as commissioners, what is our commitment? once we roll off. Right, because we just can't disappear into the sunset, right? We did all this work for 4 years, so like, what's our role? And somebody's gonna slap me upside the head, what are you talking about? But you know, what is our role? Because people are gonna, in the community, are gonna come to us and say, well, now what? You did 4 years of this, now what? You're just gonna disappear, but I think we have a role to play afterwards, right? Because I think about who can I talk to now, right now, to think about applying to, you know, be on the next commission, irregardless of who gets elected. But call to action, inspiration, but it's gotta be something else there that calls people accountable in the federal government, that we're gone, but there's others behind us who know what we did. And they're gonna hold you accountable also and follow on.
We're pointing everybody to Lisa.
Pointing everyone to you.
Get the organizer.
Emily Chen, I recall at one of the administrative meetings before our commission meetings, that we had a team building exercise where we were all in groups and we all had to come up with a compelling or punchy line. And I recall there were so many good ones from that. And I know Aja and I were in the same group, but I don't recall what it was now, but I'm just wondering if that made it in our notes. Oh, okay, yeah, that's what I was thinking of.
Do you remember yours?
No, I'm actually gonna reach out to Aja right now, because it was really, it was punchy, a little bit of punch, not too much, but a little, you know. So I just thought that we just need to have something a little bit more, you know, gets people's attention.
Those couple things that retreats do.
Karen?
I am thoroughly enjoying listening and observing all of my colleagues on the commission. The most humbling reason why I am truly humbled to be amongst all the creative minds. But I just wanted to piggyback a little bit on Mia's statements, and the first thing that came to mind is how in many of our communities, legacy businesses are being forced to either close or relocate. And so I'm wondering if the term resilience also means sustainability. And so that legacy businesses are able to survive and thrive in our communities. And along with that, a lot of cultural history is lost. And then for the emerging A and HBI communities, how so they can continue. And so, again, I don't know if the word sustainability is a part of resilience, or is it something that might be also considered as part of the figure.
Right now?
Thank you. I really like the sort of organic thought factory that's coming up with our discussion here in regards to sort of the report. I just wanted to touch on a couple of things that Kevin and Lisa and others have said in regards to sort of how we voice these recommendations. Equity, I think that's one of the through lines, but I think kind of deeper to equity is, you know, justice, inclusion, and belonging. So when you frame sort of the recommendations with that context, it looks different. And this is what I mean by that. For instance, resilience, where Mia brought about sort of the pitfall of resilience is then people turn around and say, well, you can do it already. why bother? You know, you're fine. But I think the resiliency of our communities is because we believe we belong. You know, we believe in justice. We believe in inclusion. And so I think our recommendations can be put into sort of that sort of context, if you will. Like data disaggregation, OMB 15 speaks to equity to a degree where you know, we're mandated to get the disaggregated data, but the reality is we don't, right? And so there's a way we're not included, and when we're not included, we don't feel like we belong, you know. And so I think sort of revisiting kind of how we tell the story of the recommendation will be a way for our communities to sort of see that we hear their experience, but you know, they can see the action from hearing that, right? We talk about sort of like who's going to read it. Well, there's no reason for my community to read it, you know, if they don't understand like what the purpose is, and if they don't know sort of where the you know, where you're coming from with these recommendations, they're not going to read it.
Ajay?
And listening to all the conversation, I think 3 or 4 words comes to my mind, which would be considered adding to what has been proposed: empowerment, government action, opening endless opportunities. That was 3 words.
Kimberly?
Yeah, I just wanted to make a point that, well, I think the majority of this report should be for our community groups and the general AA and HPI community. I also want to make a sort of a plug for a broader education for the majority communities who often don't see AA and HPI diversity issues as something that belongs in diversity, equity, inclusion, and belonging. And so some of that education is really needed. I mean, we're only 6% of the US population, and there's so many different groups, and I don't think a lot of the broader American public understands that. And so I think we have to keep that in mind as well.
There's a lot of themes. And let me, well, maybe there might be a moment here to maybe we just all take a couple of minutes and think about the words that we want to use, and then we can think about how to weave those words together. You know, should we just take a minute and like we'll go around the room and ask everybody to put, can I just offer, just to put a limit on the number of words? Put 3 words that you think stand out to you. That doesn't need to be a sentence. It doesn't need to be written in a sentence. It just needs 3 words that you think are important for this theme. We can pull that out, but we sort of need to think about it from that perspective. And then we can go around with each person and everybody sort of give your 3 words, and we'll sort of try to pull something together. Does that make sense? I know it's hard. That's why the limit of 3. But I think it's important because my guess is there's a lot more commonality, and there is a lot of commonality in what's being said. We just need to pull out something. So let's just take 1 minute. Each person write down your 3 words, and we will start with Victoria. I want to start.
What everybody's thinking. I'll make you guess my 3 words. 3 words, first word.
No. We're not playing that game. That'll be dinner time. Because I'm really bad. Okay. Carrie, do you want to start?
So there are a lot of words, but I think it's how I'm processing, right? Like we want to uplift the voices of our communities, uplift voices. And we're demanding actions, right? And our end goal is equity. Right?
Kimberly, before I get to you, I'm gonna see if Mia wants to go next. She's still here.
Can you go to the next person and come back?
Okay, we'll go to Kimberly.
Write it up on the.
Yeah.
Yeah.
So we have,
This.
and we have uplift, voices, demand action, and equity.
Just a reminder to not have side conversations because it crowds the audio for the people listening.
Okay, yes. Uplift voices.
And action.
Demand action. And equity.
Can I request a little bit bigger font for the vision impairs?
Sorry.
Okay, so I had more of a phrase.
Okay.
America, this is us. Is that a TV show?
Reynold, do you want to go?
Sure. I came up with purpose, hope, and belonging.
All right.
Well, this is so trite, but breaking barriers keeps coming back for me, because we're talking access. We're talking changes in terms of governmental approaches. And ultimately, I think we're trying to break barriers so that our communities can flourish and can in fact, be more prepared and resilient. Yeah, but in the final, I would want to change those words.
Yeah.
So try to.
Mia, do you want to go before we get to Carrie, or do you want to wait?
Yeah, I know breaking barriers is not one word, but I'm pretending it's one word. Equity and connection.
All right. Carrie?
Resilience to empowerment to sustainability.
Process.
To empowerment. To sustainability. Simon?
Inspire. Engage.
Inspire.
Access.
I like that.
I'm sorry, inspire, engage.
Access. Yeah,
Ajay, you're gonna mime it up.
Empowerment, sorry, there, empowerment, endless opportunities. Government action.
So just one question, so is the goal though ultimately to come up with the, like, kind of a mission statement? Okay.
Unless you want the three of us to still.
We want that to be 3 words.
No, I'm just saying, put 3 words and we'll try to put some sense together. There's common themes already emerging
Yeah.
as you hear, and so we're just trying to.
Well, what Renell said, actually, it had, when he pointed out justice and being part of equity, and then I looked down and this whole thing you already have here, it says advancing equity, justice, and opportunity.
That's the
And then, and inclusion and belonging, right? So I summed it all up into just 3 words, advancing equity.
Emily?
I had a lot of these same words. Okay.
For me, everything I think that we've done, boils down to 5 words. So I'm gonna give you 2 extra for extra credit. Comes down to inspire, community, service, equity, and connection.
Not community service, right now, community. And
Oh, I think he said.
and we already have equity and community service.
So, of course, I didn't follow instructions because I never.
Right, you're gonna need to speak up too.
So the theme that I came up with, I can't do 3 words. It was just really the government that represents and serves all of us.
Honey?
I see community there already, so I'll just say justice and accountability.
Yeah, accountability.
I know I belong to this group because nobody can follow the rest.
I didn't expect that. I just gave general ideas.
Voice, equity, action.
Voice.
Voice, equity, action.
Boy.
Yeah, action.
Action.
equity, action.
Lisa.
Have justice forward, accountability.
Yeah.
Them a lot of these things.
Okay. We generally have some things, maybe if you don't mind, maybe we can take like a 10-minute break and we'll try to pull some words together. And what the reason that this is important is we need direction from the commission on the theme, so we can sort of build the opening and closing on that. So what might be good is for us to then take, like, let's take a 10-minute break, gather all of this, sort of put some ideas forward based on all of the input that's been given. And let's see if we can sort of vote our way through this.
We'll have to vote on the final.
Yeah.
On 3 words.
No, that's right. Yeah. The consistency of the words actually is very helpful because it's sort of giving, even with different words, the theme is it's emerging. So it's very helpful to have. So thank you for this. I mean, I think if I take away anything, it's like there's a sense of action, there's a sense of community, and then there's a sense of sort of equity and like what we're trying to do. So we'll come back to you with some ideas on this. But I think this is super helpful. I just want a couple of comments I want to make as we sort of go into break for a minute. And I think, and I hear all of you and I appreciate consistent coming back to community and the theme of community. We, you know, we are all on this commission because we represent our communities and it's an opportunity for us to give voice to communities that don't always have voice. And I think, let me just propose here that I think our job is almost a bridge. We're always the bridge and it is important. It is hard. And I think the hardest part is we're always never sure we're doing enough. And we're always never sure they're hearing enough, right? And so that's the balance that we play in the bridging aspect, but there's never going to be enough, to be fair. Kaying, and I'm looking at you because you said just really spoke to my heart. I appreciate it. Is that I think that it's never going to be enough, but all we can do, and then this commission is open that door for the next group to do more, but also give room for more people to come in because the door has been opened. And that's what we will do out of this commission. And then that's what every commission has been doing, but know that it's never going to feel like enough because there's so much more to do. But I think the importance of opening that door is actually it's extraordinary. And I think what Crystal, what Erica have done for us within this has been extraordinary. So it's something that we should go.
Oh, yeah, I just wanted to say, when you say represent, I mean, that's exactly what we're doing. How the word is, we're representing both sides, community to government and government to community. So it's in the word itself.
Yeah. All right, let's take a 10-minute break. We will come back and vote. And we'll try to, in that 10 minutes, try to pull some themes together for voting. Thank you for doing this and thank you for your willingness to sort of go through this exercise. Okay, we're back. All right, do we have Mia and Reynold still? Just checking.
Yep.
Excellent. I don't know if we sent you all the language, but I'm gonna read it out and we will give feedback on it. This is not a done deal, but I'm gonna stand up just because. We sort of went back a little bit to when we had our conversations before about words. And Emily was kind enough to remind us that there was a one that said invisible no more. And again, just thinking about the highest level theme, this is not about what's in the report, this is at the highest level. Invisible no more, amplifying our voices to build a more sustainable future. An hour meaning we're already at the Commission on Asian Americans, Native Hawaiians. Feedback. Come on, Kevin.
I really want to focus in on 3 words, because I feel like once you get too many words, even though we're trying to convey so many concepts, I think you lose people, you lose the community, you lose that force of what we're trying to get at. So that's just my.
Yours was equity.
Mine was just advancing equity now, and because you already have it here as advancing equity, justice, and opportunity as the big theme, and then as bullet points, you have each of our subcommittee, right? So we've already kind of gone through this exercise. I think that's what we're trying to do. The advancing part is, some people talked about breaking barriers, that's pushing forward. We talked about equity, Reynold talked about justice, but I think opportunity, justice, and inclusion and belonging, all of that fall under the bigger equity umbrella. If you had to pick one word, it doesn't always fit perfectly. And then now I think is so important because we made 70 recommendations. And if, we're always saying we want to leave a legacy, we want to make sure things are happening and that we just don't have this big folder file that we just keep passing along. So that now it presses upon the urgency for our commission, the following commission, the commission thereafter. It's like, we got to get things done.
I think one thing it leaves out is the community centered. That I think is what hopefully distinguishes our commission from other commissions. I think also a lot of the words we're talking about, one of the bars we should try to cross over is, does it sound different than any other commission? Meaning not even a HPI commission, but how is it specifically relevant to what we're doing versus what other commissions are also doing in the administration?
Right, and to that point, I think when you say invisible no more, amplifying our, I think that speaks to so many communities. Maybe it's advancing community and equity now, or community equity, advancing equity and community now. I know we want to get the word community in there, but I just think.
I think our relates to community, because
So
as
advancing our
was
equity
said,
now?
as was said, we all represent our own community. So the idea was, it encapsulates the idea of communities as well as building being the bridge, as Hawaiian had said.
So how about that?
We're also more invisible than others. I disagree with you when you say that's similar to other organizations, other groups. I think we're much more invisible than Blacks, Latinos. We're always last. Always. We talk about this in all our meetings.
And that's why we need to advance our equity now.
Yeah, but equity is a word that's just so commonly used. It's lost its meaning, to me at least.
All right, put that others.
It's too long.
Okay. Ideas?
I agree with Kevin. I think keeping it shorter and sweeter, 3 or 4 words would be better. Whatever they are.
Others? Great.
Yes.
Do you have the other ones that you had, that we were sort of looking at?
Well, these are all the words. I think there's,
See the orange ones that we.
I can read you a few of them. Amplifying the voices of our community. Raising the visibility of our community for the future. Raising our voices for our future. Ajay?
One more option. He's saying he's pushing for 3 words. Amplify advanced spirit.
Well, no, but he used ChatGPT. That's why we were laughing because
Yeah, I use.
he took all the words that were suggested and then he just put it into ChatGPT.
And I
just
told-
to see what would come out. Yeah.
Or chat. Smart.
I gave all the words and I said, give me 3 words out of this.
How about our voices, our future?
That's very low.
That's actually one, yeah.
Yeah.
Our voices, our future.
I think that's good. That's good. I like it.
I'm with them.
Yeah.
Mia, right now?
Reynold?
You like.
I've never seen it.
Teresita.
Well, I'm uncomfortable with that because we have so many communities that will continue to be underrepresented. We have so many communities that will continue to be underrepresented, even if all of these recommendations are done. And I don't want to overrepresent that we have solved things. So that's my discomfort.
I don't know that we're implying we're solving anything. I think we're saying we have a voice in to prepare for our future.
Well,
Determine
to
our
me,
future.
that phrase has an empowerment thing undergirding it. If it was a community-based effort rather than a commission effort, it would be different.
But our, I think in the case we were talking about, when we use the word our, we're including communities because we all represent different communities and community CBOs. So it's not our like commission, it's about our as a collective.
Well, there's still communities who are not represented among the commissioners. Regions that are not represented by the commissioners. So I think there's got to be power yet humility in whatever messaging.
Well, let me push on that and to say, I get the humility piece, I understand it, and I think the challenge is, if we want our voices to get heard and we're worried about humility at all times, our voices read with that same humility. And I'm just pushing ourselves to say that maybe this is not the right terms and maybe it's not exactly the right way, but I will just say, I think at some point, we have to want our voice to be heard, and if we're worried that this is not humility enough, then our voice will be seen exactly that.
Yeah, I'm more comfortable with what Kevin has suggested. Aside from communities, there are issues we have not really dived into, except in incidental ways like education. I've actually been asked why we do not have an education subcommittee. And I know that was brought up in the past. And that is such a major uplifting mechanism for all of our communities, yet we did not really cover it as an issue. So that's part of my discomfort with such a sweeping statement of our voices, our future.
Our voices, our future now.
Just that's even more presumptuous.
No, I don't think so, because you're saying that this is where we are right now. We're trying.
It's also,
Our
That's what I
voices
can-
and it's
now.
also aspirational.
Right. The theme is supposed to be a vision that we're trying to reach for, and also, which we'll cover in the next part of the agenda. Each subcommittee will be writing their own position, so there are all opportunities to use all of the words that we use. in everyone's individual subcommittee contributions.
I want to see if this would capture it, because I get what you're
So
saying.
Lisa, sorry, can you speak up?
Yeah, I want to see if this captures it. How about growing our voices? Does that capture more inclusion and acknowledging that we haven't captured all of our voices yet?
Well, I think that's better.
What's your recommendation?
Well, I still like Kevin's.
Do you like Kevin's?
Yeah.
We like advancing equity.
Yeah. I think it's to the point.
How is that different than what the administration wanted to do?
So then maybe,
How is that different than what the administration's already saying? How is that distinguishing the Asian American, Native Hawaiian, Pacific Islander population? Mia.
I think there's a way to say that, we as a commission are trying to represent all of the different communities, but understanding that there's no way that we can represent every single voice in every single community, and that, while recognizing that we still have farther to go, that we have made some progress. So I think that it's important to recognize the progress that we have made, but also recognize that, we hope that the next commission is able to continue the work that we have already and those before us have already done. So I think there's a bit of a way to do both, if that makes sense.
Yeah, that makes a lot of sense. And I think the narrative, we need to say that. So agreed.
So how about, and let's just go ahead and break this. We keep what our EO states, right? Advancing equity and justice. Centering our community voices.
Centering what?
Our communities' voices. So still advancing equity and justice, centering our communities' voices. And that's it. And then centering our communities, fostering voices.
Sounds like a big time report.
I think I can live with that.
I don't know. I don't want to read it.
You don't want to be the theme or?
No, I mean, if that's the title, I'm like, oh.
Again, I'm just saying, how does this distinguish us from what the administration is doing?
Well, what we've been doing.
It sounds like the EO, then why not just read the EO?
But what we've been doing is specifically addressing what the EO doesn't do, doesn't cover in real life in terms of providing the access, providing the tools like cultural and linguistic. We've been in the recommendations, we've been pushed over time to get more and more specific about what the administration.
Right, so Darcy, I'm gonna push, not only just because I like pushing on these things, and yeah, I feel like I'm in an academic conversation where every academic wants a policymaker that wants their word in there. And then so you have these crazy reports that everybody wants to read after the end of it. I'm pushing only in the sense of if we want somebody in our community to read this report, why would they pick any of these titles?
Yeah, I think the nicest ones, Kevin's, put in a close second, but the our voices, our future. Just keep it simple, relatable. People will be more likely to read it, something that's much larger.
I also think, you know, for many of these communities, they don't read these type of reports, right? And I think it's in addition to the title, we also have to think about the strategy of dissemination. And so I think that needs to be kind of a layered approach. And so I don't think we should just sit with the title being the only carrier, like the only way it's gonna touch, you know, it's gonna pull the community in. So hopefully that will take some, you know, we need some strap. Finding it all in a few words.
They want to appeal to more, to as many people as possible. You know, like I'm in a much different position than most of you, and you have a lot of experience in the community. But for someone like me to pick up this report, you know, a ding dong like me, it's gotta have a title that's gonna make me feel like I really want to spend time to do it, because everyone has limited time. So if it reads like something that's, you know, way above my head, I'm not gonna open it.
So I've served on lots of different boards and et cetera. And the one thing that really makes this difference is that it's the presidents and the curiosity that I've gotten from my communities is that why is it special? Do you really have access to the president? Does he really care? So I think that is what makes us unique versus some of the state, local government commissions and task forces have been on. And I know it's in our logo and stuff, but to me, at least in the work I've done over my years in the community, the difference has been at the level that this commission is at. It's at the highest level in the country. So somehow I think that's the interest in our community. That is part of what we're grabbing.
But a lot of the recommendations from prior commissions have never even been implemented. So we're at the highest level, I would say to you as a layman, like, well, why haven't, if we're at the highest level, why haven't all those recommendations been implemented? Why do reports from previous administrations all read the same?
And the difference with us is we've already gotten some approved and in the process of implementation.
I know, we're going to the details of what the report will say. I just want to go back to title. And I think I think we're mixing two things. We're mixing what's in the report and what we might say with.
And I would say the theme is, what is our intent as a commission? The nuts and bolts of what the recommendations are and what was passed and what each subcommittee built is different than what the narrative theme is of what we all collectively came here to do. Now, the measurements of did we come here to do are in the nuts and bolts of the report, but the theme is, what did we all come here to do? Why were we all individually chosen in order to serve on this commission? And what I have heard from people is that, again, you know, Kamal, I agree with the aspiration of bringing our community voices to hold the government accountable so that we can have a better future. To me, that's, I think, what we all came here to do. And that is what I think we should focus on when we're thinking about the theme. Not did we do it, that will all come in the other report. This is like, what is the larger umbrella that holds us together? And again, our intention of coming here and doing this.
And so that's why I think when someone you frame the question, which question you said about when someone reads it, they want to pick it up, or
Yeah, will someone pick it up?
right? So to that point, like Emily, you point out that maybe you wouldn't pick it up, and other people have different experiences. I think at the end of the day, the people who are going to be most interested in actually opening this is the community groups that Teresi is talking about, and my friends who are, HPI folks that are relatively doing well, I think they would pick this up, even if it has a presidential seal on it. I think the community groups, the grassroots groups, they're the ones who are gonna they're kind of waiting to see what we come up with, And then they're the ones who are gonna show up tomorrow, people who actually will be there, they're the ones who are gonna crack this open. And when they crack it open, I think they wanna see action, they wanna see urgency. They wanna see us understanding that they feel that there's a gap of equitable access, opportunity, justice, perception of Asian Americans as not American. Those are the things that that particular audience that will naturally really be focused on. And if they're gonna pick it up, I don't think our voice is our future. I get what Sarah's saying, and I think it's an excellent point. That's what we're all here to do. But really reads a little bit more like, you know, like not as aggressive. Like an Asian American, sometimes we come up with these nice themes that reads to me a little bit more like a novel versus like this whole thing is not. At the end of the day, it is about action items that we're asking. So the theme should reflect that, especially to the audience that will most likely be thinking this.
But isn't that the point of the, I mean, that is the executive order, is advancing equity, right?
Yeah.
So how do we differentiate?
Well, why do we have to be different than the executive order is the purpose of the hour, I think is what's the biggest, that's why I said, when you said hour, I totally agree with it, because I think that's what makes it different than the executive order is like, oh, advancing equity for Asian Americans. We want, as an administration, to get to that end line, but we are now asking you as representative of various communities, not all communities, but various communities, to insert your voices in here and help us get over that finish line. And that's why I think that our insertion into the rest of the executive order theme makes it into our report, our commission report, our voice. So I really like the hour. That's why, to me, that made it complete.
Sorry.
Right now?
Yeah, no, I agree with everything that you're saying. I will say though that the voices theme is a little outdated with a lot of at least NHPI community groups. You know, I think 10 years ago everyone was naming their conference voices. You know, everyone was talking about sort of needing to be heard. The through line though, what I do like about kind of what you're alluding to with our voices is that the through line for a lot of us coming here is that we don't count, right? That, you know, a lot of times in policies, it appears that we don't matter. A lot of times in government processes, our communities are ignored. So I agree with Kevin. I do like the idea, you know, the advancing equity is very simplistic. I mean, it gets to sort of the heart of kind of what all our recommendations are going towards. But just as what Sona was talking about, everyone's used that. You know, everyone's kind of used advancing equity and justice and then just insert disenfranchised group, which, you know, I don't know. I don't know if it's worth the time to sort of like market the report versus spend our time trying to get the community to understand what the report's about. You know, but I will say like, I wish we could speak to sort of like overcoming some type of disempowerment with the report, because that's why we came. I mean, that's why we're putting in the effort, and I'm just not hearing it with kind of what's been brought out, except for what Kevin mentioned in the beginning. But like I said, it's gotten so used that now people are going to think our recommendations are going to be just like everyone else's recommendations because we use the same type.
Yeah.
Yeah, I was thinking about like what makes us a bit different from a lot of the other commissions, because our commission started in the middle of a freaking pandemic, right? We started while being online. We started when there was basically an anti-Asian wave of sentiment that was going on. And I think it's kind of important for us to recognize within our title how sort of the urgency of the work that we were starting on during in the middle of all of that. So I would like to find some unique way to sort of refer to that urgency and to that unique circumstance that we were living in.
Thank you. All right, let me ask, does this convey enough urgency?
And now,
Okay, I just, like, we need to come to a conclusion, so I'm sort of trying to push us to, if this is where we're at, does this convey the urgency that we are looking for?
sounds.
I'm sorry, can you read that for me?
Oh, sorry, advancing our equity now.
Ray and Mia, were you able to hear that? Oh, okay, it's in the chat. Right.
Yeah, I could hear it.
And
I think, can I say, sorry, I think you can start with that and then have us like a colon with an explanation of like, you know, moving towards X, Y, and Z.
About advancing our equity and voices. Doesn't advancing voices, no. Okay. You know, the one interesting part of this is that, I like Emily's point that, you know, you said certain other communities don't feel invisible, that we're the only ones who feel invisible, right? And that others probably have used this advancing our equity now theme. I don't know, like, as Renaud said, our voices, and it's true, like, maybe that was part of it, being involved with the Asian American community for the past 25 years. And a lot of these national conferences, they use the voice theme a lot. But I don't know if I've ever seen Asian Americans step up and ask for demand action. And so maybe that's advancing is not the right verb. But what I was trying to get at is I just want us to be on that same level of everybody else asking for stuff, right? And if others have used this title, but we haven't, people will be like, oh, I'm kind of curious, what's the Asian American ANHPI community looking for in, you know, advancing, what is their definition of equity? And so maybe I'll crack it open because it's coming on the highest levels, presidential, and it's coming from a community that hasn't quite demanded like we are going to be demanding now.
We just said the title sounds like.
It sounds
It
like
could be
a
for another
nonprofit
commission.
organization.
And I would say my experience in nonprofit world, was I serve on, which encompass helping children and underprivileged. Asians are never mentioned. I serve on, you know, whether it's, you know, New York City, addressing poverty, addressing children's needs in the nation. Asians are never mentioned in any of the conversations. It's Black, Latino, you know, now the migrants, Asians are way low, are not even part of the conversation. So it's just something to keep in mind that we want to be super diverse and recognized.
And I want to help Sonal get to a closure on this. So I'm not stuck on these particular words. I think what I was just trying to keep to the theme of short, concise, no colons, please. And then just trying to get a demanding, active urgency. So however you want to put it, but if that's too nonprofit-y, then, you know, you want to add more other types of.
Let me offer an idea. Amplifying our voice to advance equity.
Two.
Amplifying our voice to advance equity now.
I move that the theme be amplifying our voice
to advance equity in.
Nice second.
Second.
All in favor, all in favor?
We need to keep it.
Yeah.
Can we just do one more, like, creative?
Yeah, we can start. Amplifying our voice to advance equity now. We can do voices.
Voices. Yes.
Amplifying our voices to advance equity.
Yeah.
Reynold, Mia, are you guys okay with that?
No,
All right.
I don't mean to be like picky. It just sounds passive to me. I don't know why.
Well, we're gonna at least use this as a moment to move forward. I think there's enough. We can come back and change the title later, but at least we can use this as a theme to move forward. Yeah. Is that good?
Call for a vote.
Do you need a vote?
Everybody doesn't have to vote yes, but we need a majority on this.
Yes.
All
So
right,
you can abstain or say
No.
no. But the majority of the vote will pass the motion.
So somebody had already
I think
motioned.
Teresita.
Teresa had motion, Emily had second.
All in favor, raise your hand so Judith can count. All those who abstain. Luis and Robert and Mia.
And no,
Right.
awesome. Thank you. We're gonna keep moving to talk about the report portion, because that's actually the meeting part of the. And I'm gonna turn it over to Sarah, but I think again, while there be sort of overall theme and a conversation, the real work is gonna be done in the subcommittees as to how it's framed, what we framed, what we did, why we did it, and that sort of the issues. So, kind of pursue.
Thank you. So I think in everyone's folder, there should be a page that says final report draft template. And then it starts with out, right? Outline. Does everyone have it? So we need to vote on the actual template. If everyone just wants to take a couple minutes to read through it. It's fairly straightforward. The goal is 15 pages of text, which does not include the cover, the table of contents, and the appendices. So that will include 1 page with an executive summary. And then the bulk of the report will include 2 pages per each subcommittee to identify their priorities and work. So as we have all seen the priority slide, a lot of the raw content is already there. As Ajay had asked, all of the recommendations will be included in its entirety in the appendix C. So there's no need, in fact, the subcommittee should avoid just recapping what the recommendations are. And the 6 subcommittees are listed as below. So as I mentioned, each subcommittee can talk about what their overarching themes are, what their goals were, intentions, how they felt that they met their priorities, how they developed their priorities. That's for you to discuss amongst your subcommittee groups. Any questions so far? Kevin?
The only thing I would ask is it possible to have like a one-page cheat sheet for all of the 6 commissions? So that we can just reference that very easy. I know getting it down to 2 pages per equity and 15 pages is kind of the summation or shortening of the full recommendation list, but can we actually go one step further and just be able to bullet point summarize just a 1-page cheat sheet? I just find,
I'm not sure what you're asking.
what I'm asking is, can we also include a very condensed version of even this final report?
That'll be an executive summary.
Yes, so I guess that was like, I looked at the executive summary, because executive summary, you're gonna put each committee, subcommittee, and you're just gonna have 1 paragraph. But what's the structure of the executive summary?
Once we receive everybody's 2 pages, that will dictate what the
And it'll be
executive
one
summary
page, one pager.
summary of all the.
And one
all the
page.
executives.
That's the hope.
What?
That's the hope.
It's a definition.
But
First,
executive summaries can sometimes be 2 pages. 3 pages, that's what.
The goal is 1 page.
1 page, okay.
Teresita.
Practical
Yeah, that's
plus,
why this page.
Got it.
Exactly. Teresita,
practical plus, can we be given,
sorry, can you speak up?
word count?
A word count?
Yeah, so a couple of pages, you know, depending on size of font and all that, for consistency, word count might help.
I'm gonna guess that's 800 words.
Should be about 2 pages.
Based upon, yeah. Based upon the page.
If you shrink it down to 8, we can have.
Well, it's not gonna be 8.5, it's gonna be 10 or 12, probably, there'll probably be some government standard. I assume. Time
So approximately,
so just,
It's about 800 words.
yeah.
If you want to keep it to 800 to 1,000.
Yes. And remember, this isn't space to recap recommendations, that will be done elsewhere.
right.
Which is why everyone will be allowed from their subcommittee level to discuss what it is they want to convey, which is, I think, why we were trying to move that everything wasn't going to be just about the theme, but that everybody would have the opportunity to discuss at a much more granular level what it is they set out to do.
So more of a deliberation and development process that we went through.
That's up to your subcommittee to
Oh.
decide how you want to deliberate. Lisa.
Yeah, so as one of the appendices, are we gonna actually list recommendations that have been implemented?
We can, I think we can discuss whether we maybe identify where recommendations.
Right.
That won't be a separate appendices, that will be under one appendices with all the recommendations, but we could maybe have. and
Like
just-
listening sessions, you know, because that.
Right, yeah,
That could be.
the conclusion may be in the included accomplishments.
Yeah.
Grace.
Oh, no, I was, we'll get to what's on my mind.
And in that accomplishments, are we allowed to take credit for things that we see are happening that aren't necessarily referred back to recommendations that we made? But it looks exactly like what we recommended, especially in language access with some of, like the agency work and all these things. You know, they don't come back to us and say, oh, we're doing your recommendation, but it kind of looks like our recommendation.
I think Victoria had brought up that an interesting device to include are stories. So that is stories of, you know, however we interpret that. I don't know, Kim, if that's what you're talking about. There isn't.
I might apply it and say you do. These were the things that we were focused on, and we are happy to see that the agencies are doing X, Y, and Z. So it's without taking credit, but you're taking.
Right. So we're saying is that that's gonna fall under the sections, right? Because the executive summary is one, so I don't see any other.
It's not in the executive committee.
Right, so, or summary, so is it the
There are empty pages.
I think you need to add another appendix.
But like a summary of the accomplishments, the whole, and so would that fit in that one page of executive summary, or do we need to have another?
I don't think we're telling you, I think we'll do a separate section on accomplishments. I don't think, but I think in your subcommittee, if you want to say things that happened since then, you can say that. Like that's a call within your subcommittee of how you want to approach it. But I do think the accomplishments we can put it. we can put it separate.
So, just to get a little bit more granular on the guidelines. Outlining the challenges for AA and NHPI communities that the subcommittee has prioritized. Highlighting key recommendations as they support how the subcommittee has prioritized those challenges as opposed to listing them out. And just to echo what, or reinforce what Crystal was saying, it is 12 points font size, which is likely to bring us to 800 words. Please include a section title that references your subcommittee's title. Please include citations if you are referencing outside data.
Chris? Really quickly, I think largely for today, you're trying to figure out the structure, and we have given you every single report since the Clinton administration. You can take a look. You know, I think the preference under this administration, it has been for conciseness, and so you will have all of the appendix with all of the recommendations matched together. But even, you know, I think, I don't know if I recall who mentioned this, but the Health Equity Task Force report, I mean, there are, you know, kind of models you can look at. The other thing we wanted to flag is we're going to also design your report. So it's not just going to be pure text, right? You're going to have, you need to pull out like a block quote or put in photos. We need to put in infographics, like we can put all of that in. So that will add some space. But I think in terms of the actual text, we're not looking for this to be a 300-page of text, right? It's like, we want to, how do you distill what you've done and what are the sections that you want to create? So it sounds like accomplishments is a piece you all want to highlight. But I think this whole framework you have right now is to react to, is this enough? Do you want more? Do you want less? Again, we don't want necessarily this like 200, 300 page report. I think the last commission under Trump did about 50, the average about like kind of 30, 50, even that, you know, tends to be a lot. So for instance, our national strategy was 30 pages total, but that included pictures, right? So it was like actually only about 12 or 15 pages of actual text. But then once you added the photos, you put it in the page breaks, all of the formatting and design, it ends up being longer. So I just want you all to keep that in mind. We're going to work on also designing your report so the public is going to want to read it, and it doesn't look like this, you know, massive like 50-page paper. But really just the discussion for now should be focused on what are the, for this outline, what are the sections you want, you know, and also how long do you want these to be? You can refine some of the parameters, but I think that's really what we want to get to today. What is like the meat of what you want in this report?
One thing to keep in mind, I know that we're sort of focused on the public reading it and getting it out. Sometimes when the next person comes into a government agency, the shorter the piece, the easier it is for them to read. The longer the piece, the less you are likely to read it. So part of the reason the 2 pages, as you know, when you came into your position, if it's short, you can go and find more details. But if it's too long, you won't read through the details. So it just part of the reason to keep it short is just recognizing the other readers of this are people who may come into jobs that are looking at how do I advance AA and HPI equity, and what are the recommendations that were made. So if they're short enough, it's easier to.
Add to that. So I think I wasn't clear on the executive summary. The reason why I was asking that really with that thought in mind was the social media aspect of it, right? Like, even if it's executive summary and it's in words of 6 paragraphs, short paragraphs, I don't think it's as conducive to marketing on social media versus, you know, maybe it's a couple of highlights that we all look through from each commission that you would be able to just put out there. Here's some highlights, and then
And we're
here's
going to talk about that in the next.
Got it.
And we, I'm sorry, Grace. Yeah, so one of the things, and this isn't in the document, but, and I don't know what role you'll have as the group of us in trying to make
flow go in terms of each section being potentially really different from each other, so I guess we'll figure that out, but one of the things I just feel like is helpful when I'm reading these, and I am one of those people that reads these reports. I am one of those nerds. Is that like to the extent, and I don't know if we can do it, and I don't know if people have stories, but I just feel like if, to the extent that we can personify what it is that we were trying to accomplish in our subcommittees, like to the extent that there are like groups of people and individuals and be able to like shape it in a narrative as to, you know, how come we came up with, you know, whatever big recommendations are the top ones and how that might impact that. And it makes it just much more interesting to read. So I don't know, you know, how doable that is and how we do that in the context of anonymizing people and there are no stories, but I just think that that is so much more compelling. So I'm putting that.
I agree. I think there were a lot, at least for me personally, a lot of timely events that happened. I think Diya obviously mentioned COVID. I think Bradville, I remember Carrie talking a lot about, and a lot of other events that occurred during our term. And I think that might be a nice, that's one suggestion of a way of humanizing and putting some context and currency into our report. Are we, does everybody feel ready to vote on a template? It sounded like the template that was put forward in everyone's packet with the addition of a separate section of accomplishments is the template we're moving forward with. Do I have a motion?
So,
Second. All in favor? Aye.
Mia and Rena.
Yep.
Excellent. And just as a note to everybody, Commissioners Daniel Day Kim and Smita Shah are not present for voting. We'll move to a 10-minute break. If everyone could just stay in their seats until we are pause of the live stream. Thank you for that discussion, everybody. Welcome back, everybody. We are about to start the third part of our agenda on our strategic planning agenda, which is outreach and engagement strategy. Kevin had touched on this before our break. One of this will be discussion on how we use our report to reach out to the community and how we distribute it. I would like to, we've had a couple of discussions that some of which started in October. I would like to make a motion. We've had discussions about turning the language access subcommittee into the language access and communications subcommittee. And that would mean that that subcommittee would handle the create a structure for the outreach for the reports to the community. Now, that's not to be confused with individual commissioners who will work, who can and will work with Beyond Food on specific ethnic media and press outreach. That's separate than what we're talking about, the language and communication subcommittee. It's gonna pause there. You know, that's a lot to absorb. If anyone has any questions so far.
How does that subcommittee, feel about it?
The language access subcommittee has discussed it in our subcommittee and is supportive of the recommendation. Harry?
Oh, I was just going to comment in an attempt to influence the vote of the commission that the chair of the language access committee, that the co-chairs are so capable and Dr. Kim is just loves to be volunteer.
Commissioner Doyle, it sounds like you're trying to make up for all the comments that
I take the bit.
If you look at the language access priorities, they are very much in line with how we'd like to convey the work of the commission through the report out to. And so that's part of the rationale of how that's happening. How that's being added to that. Questions? Marcita?
Oh, just an observation, it's a very small community. It is.
Well, powerful.
Small, but.
Are you coming
That's
back?
my belief.
And both of them are writers too.
Well, my
that
kid's also on the subject.
Yeah, but the two co-chairs. Well, I guess capacity is the issue. You know, we have such short time.
I think it's a reminder, this is a framework for the outreach as opposed to doing the outreach themselves.
Okay, thank
So
you.
this
for the
is not,
clarification.
just what's not, but yeah, just to keep in mind, this is the framework for the outreach.
And again, there's a separate track that will work directly with Beyond Meat on actual individual commissioners doing outreach with ethnic media and other press outlets.
Thank you.
So you're not off the hook and being out there, pushing you out there to talk.
Yeah, Karen. Remember that.
If there are no further questions, I'd like to make a motion to amend the language access subcommittee to be the language access and communication subcommittee.
So, second.
All those in favor?
Aye.
Oh, Louisa and Dr. Underwood, are your hands raised or?
They were.
Thank you. Thank you.
Tiny.
Yes.
No more just me.
So just to, before there's still a broader question, Kevin, you had raised about just how we get the information out and modalities. Crystal, it might be just helpful, sort of.
Sure, so I know we've written this to some of you, but this is gonna be actually the 25th anniversary of the creation of the commission as well as the White House initiative. That were both created in 1999 under the Clinton administration. So as part of that, WIOMPI has been working to put together a number of things, including the video series that will do both an overview of our history, but also deeper dives on specific topics like combating anti-Asian hate or health equity or economic equity, to kind of talk about for the general public, like what are some of the work we've been doing, but also our accomplishments. And I think this is where we can also highlight some of the commission recommendations that have been implemented. So some of you were with us in Atlanta. We had actually a film crew with us to be able to film, to take some B-rolls, do some interviews. We actually have this tomorrow too. We're going to be interviewing folks here. It's a mix of commissioners as well as local community leaders. And so we're taking this information and packaging it so that we can put out these digestible videos to the general public about what the work we have been, or what work we are doing. And I think to Kevin's point, we've talked about the need to really make sure that we're reaching the public, right? They're not going onto government websites. They're not even following, oftentimes our government like social media handles. So it's like, how do we make this a lot more digestible? How do we utilize your authority as spokespeople that is merely, granted in the executive order that extended your commission's term, to also have you all serve as surrogates or as voices for the communities that you all have ties to as well. So again, I know some of you, we've already asked you to interview in some of these videos. For those of you who haven't, we may be tapping you in the future, but just wanted you to have visibility and also the public to know that we're working on these to be able to package together and roll out. Some of it will happen in May during Heritage Month, some of it will be a little bit later in the summer. But I do think everything you've talked about in terms of the dissemination of information, at least for the accomplishments piece of it, we can definitely include a lot of the work the commission has done as concrete examples of how we made a difference and how you all have made a difference in real time for this community.
Mia?
Sorry, that was leftover.
Again, it's important, and not only what WIOMPI is doing, but as we also think about our commission before getting out to people, think about the networks you all have and sort of how and what are the names we should be putting together as once the report's done that we can be sending it out to everybody. We are also the amplification engine of what WIOMPI does. So anything, think about each of us represents different communities. Anything that comes from us will go to different places, and that also matters. Who else should we do that? Are there conferences that the report can be presented at? Are there places where people can be represented, the report can be represented, what that could look like? And there's many, you think about economic equity to immigration to health equity. There's just a lot of places you can imagine the opportunities to further the report. So I keep that as just there's a bit of like putting it on social media and putting it on a site and all of that. But there's the rest of it, which is something that comes personally from someone, goes a lot further than just a report on the site. So I put that out there just for us to think about. And also, if you have ideas, send them to the subcommittee now that have been renamed. But I just put those because once we have them, it's also important to do that. We should keep that in mind. This was a very helpful discussion today. I think there was a lot. Surprisingly, in a very short period of time, we got through a lot of information from the recommendations that came from each of the subcommittees to a very robust conversation on the theme to thinking about what the report looks like. This report is going to be important for us, and it's for the legacy of our commission. So please do take the time, think about what you want conveyed at each of the subcommittees. And then we will all be collectively voting on the report. So it is not somebody's writing the report after it's been done and therefore no one's gonna look at it as a collective code on the report, so we will all be reading that report. And giving our feedback to it, so, it will be important that what comes together is the thing. And will be other opportunities for further engagement. Looking forward to our next commission meeting, which we don't know yet a date.
Please respond to the yellow poll.
Are we going long?
Going to Guam. I don't know about that.
But please do respond to the poll because we have to start making those decisions pretty quickly. And I know everybody's vacation plans will start building in and we just want to make sure we get those 2 days scheduled. correct.
The other day.
It's in the poll.
It's a vote.
Should force everyone.
Before we adjourn.
Actually, we're gonna give you
Before
that.
we adjourn, so you do
Before
your-
we leave this, so if you could take a moment to find the email and actually take the poll, that would be very helpful.
Keith, could you send me again, please? I did the poll, but now it's been a while since things may have changed.
I think you're still on there, because I did it also. I think your name is still.
No, but now my said may have changed since then, so.
Yeah. Yeah.
Cynthia Post.
We'll offline on that. All right, we're gonna go ahead and close the commission meeting for this commission meeting. Tomorrow, again, you remember, we have our public listening session, which will be great, glad we're all doing. Given the statistics that we have. it's like, yeah. So thank you all, for all of the heart. Thanks for the great conversation. And we will adjourn the meeting.
Who's at the Double Tree Hill?